I'm going to start the script. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in the order in which they were raised. As a preliminary matter, I'm Dawn Holgate, Chair of the Nantucket Select Board. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. I'll start with the board members in the order in which I see you. Melissa Murphy.
Aye, here.
Excuse me.
Bless you.
Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Matt Fee.
Yep, I'm here.
Okay. We have Paula Leary here with us tonight from the NRTA. That's actually our first agenda.
Hi.
Hi, Paula. Brian Turbot.
Present.
Ken Beaugrand.
Present.
Erica Mooney.
Present.
David Gray.
Hello, good evening.
Roberto Santamaria.
Present.
Rob McNeil.
Here.
Amy Baxter.
Here.
Libby Gibson.
Here.
Also present, we have Robert Eisenstein. Sorry.
Good evening, here.
Margaretta Andrews.
Here.
Tom Rafter. Maria Partita. Oh, hi, Maria, you're muted.
Here.
Thank you. Gary Shaw.
Here.
John Brescher. Oh, hi, John.
Here. Sorry. Hi.
I see
Sorry.
that you can hear me. Jeff
Tech issues.
Blackwell. Jeff, can you hear me? Oh, he looks frozen. Fabio Santos.
Yeah, I'm here.
Emily Molden.
Yes, I'm here. Thank you.
Oh, and I see Jeff just connected to audio. Jeff Blackwell, can you hear me? Okay, I see you down your head. Okay. Good evening, everyone. This open meeting of the Select Board, the NRTA, and the County Commissioners is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with our agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment, as we previously noted under the Zoom webinar functions. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and to take care not to share the screen of your computer. Anything that you broadcast may be captured by the recording. All meeting materials are posted on our website. As we go through our agendas, please remember to mute your computer when you're not speaking. Please remember to speak clearly to help generate accurate minutes. Please wait for the chair to recognize you before speaking. And finally, we will be taking all votes by a roll call. And we are going to open tonight, not with the Select Board, but with the NRTA meeting, then the County Commissioners meeting, and last we'll move into the Select Board agenda. Paula, do you want me to turn it over to you?
Sure. Hi, everyone.
The first item on the agenda is the approval of minutes from the May 20th, 2020 meeting.
Oh, actually, Paul, I should just say on the agenda, there's public comment.
Oh,
If anybody
right.
wishes to make a public comment, please raise your hand. But I don't see any hands raised. Is there a motion to approve the minutes?
So moved.
Is there a second?
Second.
All those in favor by roll call? Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Matt Fee.
Aye.
Thank you. Don Holgate, aye. Unanimous. And
The next item on the agenda is board approval of the updated Title VI plan. This is something that is required every 3 years under the Federal Transit Administration's Title VI program. So the only update to the plan was to update the most recent data from the American Community Survey. That is 2017 data. So I just need the board to approve that to submit to Mass DOT.
does anybody have any questions for Paula or a motion?
Move approval?
Is there a second? Okay, all those in favor by roll call, Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Don Holgate, aye. Thank you. Paula, up next.
Yes, per a memorandum of understanding between the NRTA, all the RTAs, and Mass DOT in August, there was a requirement to establish a fare policy. I am recommending the following fare policy for the board to approve. The NRTA will approach the board every 3 years about the current fare policy, and if the board decides to entertain changes, a fare analysis will be conducted in the same manner as the one that we used for the year-round service study. So I would recommend the board vote to approve the fare policy.
Any questions or comments from the board?
Move approval?
Is there a second?
Second.
All those in favor by roll call, Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Don Holgate, aye.
And then just under other business, very quickly, I just want to let the board know that the regional transit plan is expected to be done in the next couple of months. That got delayed with COVID, obviously, but we're working toward a final report and we'll present that to the board when it's available. And that's all I have for this evening.
Move
Thank
to
you,
adjourn?
Paula. Thank you, Matt. Is there a second?
Second.
All those in favor by roll call, Melissa Murphy,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Don Holgate, aye. Next up, we have county commissioners that I'm going to turn over to Christy Ferrantella as the chair.
Thank you. So I'm going to call to order the County Commission meeting November 18th, 2020. First, the announcements. The County Commission meeting is being audio and video recorded. And now we're going to turn to public comment. If you have any public comment for items not on our agenda for the county commissioners, please raise your hand. As we're waiting for public comment, there's no new business. We'll move to approval of minutes and warrants. Is there a motion to approve the minutes of September 16th, 2020? So
Move approval.
Second. All those in favor by roll call, Melissa Murphy, Aye. Don Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Christy Ferrantella, aye. That passes unanimously. Is there a motion to approve the payroll and treasury warrants for October and November 2020?
So moved.
So moved. Or second.
Sorry, Melissa.
I was
All
on.
those in, all those in favor by roll call, Melissa Murphy,
Aye.
Don Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Christy Ferrantella, aye. That passes unanimously. Moving on to official business. Item 1, request for approval and execution of assent to petition to recognize fee taking of Old South Road and approval of pending land court plan 16514-137. I'm going to hand it over to Ken.
Thank you, Madam Chair. A bit of background with respect to the first two items on the agenda. Two sisters are in the process of subdividing a parcel of the land that abuts Old South Road, and it needs to be done through the land court. And the matter's been reviewed by town council, and what needs to be done is with respect to each of the first two, need to be two motions in each. First one will be to approve the form of the assent, and then secondly, to execute, to authorize the execution of the assent by the county commissioners. Town council has reviewed the documentation and finds that it does not adversely affect the town's ownership of the fee in Old South Road. And in fact, it doesn't affect its use as a public way. So she and I recommend that with respect to each of the separate motions, that there be a motion to approve the form of the assent with respect to Tammy King's petition, and then I'll do the same thing with respect to Teresa Koshulik's petition, and then a second motion authorizing the execution of the assent by the county commissioners. Be happy to answer any questions relative to this.
Thank you, Ken. Are there any questions or comments from the board?
Motion to approve.
Second.
By roll call, that's the motion to approve and execute. Yes.
Yes.
Melissa Murphy,
Aye.
Don Hill Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Christy Ferrantella, aye. That passes unanimously. Moving on to item 2, request for approval and execution of assent to petition to recognize fee taking of Old South Road and approval of pending land court plan 16514-138.
And this is identical, and this is with respect to her sister, Teresa Koshulik, and for the same reasons, we recommend the approval of the assent and also the execution of the assent by the county commissioners.
Motion to approve and execute.
Second.
Okay, by roll call vote, Melissa Murphy,
Aye.
Don Hill Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye. Did you hear me?
yes, thank you. Christy Ferrantella, aye. That passes unanimously. Item 3, request for approval and to allow town council to execute assent to amended and restated petition to issue certificate of title to the county for portion of 43 Ocean Avenue, Sconset, shown as Lot 4 on Land Court Plan number 10300-C.
Thank you, Madam Chair. Richard and Janet Cherlin own a land parcel that was subdivided into 4 lots. Lot 4 was taken by an order of taking in 1975, but title to Lot 4 was never transferred to the county. This petition conveys title to Lot 4 to the county, and the land court wants the county commissioners to assent to the petition. Town council has reviewed the documentation and opined that not only does the documentation not adversely affect the county's ownership, but rather has a benefit to the county that will then have a fee interest in McKinley Avenue as was originally intended in the order of taking of property, and has approved the form of the assent. So with respect to this particular motion, we would like a motion to approve the form of the assent and the execution of the assent by town council on behalf of the select board.
Thank you, Ken. Are there any questions or comments from the board? What's the pleasure of the board?
Motion to approve.
I'll second.
By roll call, Melissa Murphy,
Aye.
Dawn Hill Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Christy Ferrantella, aye. That passes unanimously. And item 4, request for approval and execution of acceptance of deed for portion of 43 Ocean Avenue, Sconset, shown as Lot 2 and Lot 3 on the Land Court Plan number 10300-C.
Thank you, Madam Chair. As indicated previously, the parcel was divided into a number of lots, and lots 2 and 3 were not taken in 1975. The Sherlins do not wish to retain title to the lots and are proposing a gift of the land to the county. Commissioners simply need to execute the acceptance of the deed. So what we need to do is the town council has approved the format of the documentation and has opined that the lots have clear title and that the deed is acceptable form for acceptance by the county commissioners. So therefore, we'd like a motion to approve and execute the acceptance, approve the form of the acceptance and then execute the acceptance.
Thank you, Ken. What's the pleasure of the board?
Motion to approve and execute.
Second.
Second.
And by roll call, Melissa Murphy,
Aye.
Dawn Hill Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Christy Ferrantella, aye. That passes unanimously. Are there any commissioners' reports or comments? Seeing none, is there a motion to adjourn?
So moved.
Second.
By roll call, Melissa Murphy,
Aye.
Dawn Hill Holgate,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
Christy Ferrantella, aye. That passes unanimously, and I'll pass it back to you, Dawn.
Thank you. So now we are on the select board agenda for this evening. I will call the November 18th, 2020 select board meeting to order at 5:16 p.m. I don't believe that there are any changes to our agenda, except maybe a couple of additional announcements that we'll get to from the sewer department. But let me turn it over to the town manager to start.
Thank you. So first off, for announcements, this meeting is being video and audio recorded. Secondly, we have no select board meeting next Wednesday, November 25th, and town offices will be closed next Thursday for Thanksgiving on November 26th. Thirdly, I'm very pleased that we have Nantucket resident Maria Pardita present. She's been honored as the 2020 Latinx, I hope I said that right, Trailblazer by the Massachusetts Black and Latino Legislative Caucus. So Maria, we wanted to recognize you and perhaps see if you wanted to say anything.
Wow, thank you so much. I am very happy and blessed to be here. Thank you for giving me the opportunity to express myself. I'm a little nervous. I always get nervous. I do want to first of all thank my family, my girls, Mia and Andrea, that are here with me, giving me support so I don't faint. And the other thing is big thank to Senator Julian Sear. I appreciate his nomination and thinking on me and putting me in this list with these beautiful people. And to you all, I am very happy, and I have always said it. I always felt very welcome since the beginning, and I do feel like Nantucket is my home, and that's why I'm trying to do as good as I can. And I have to pass along to my daughter Andrea, because she doesn't want to say what I want. She will say what I wanted to say, and she will read it because I don't want to forget anything. I think everything is very important. Read it. Here's Andrea. Yes, read it.
The whole thing?
Yeah.
The whole thing?
Yeah.
Okay. I want to thank Latinx for their great work, and especially Senator Julian Sear for this nomination and those who work with him. I feel very honored for being selected for this category. I did not imagine that my dedication and passion would be noticed, and they would have me among this great list of beautiful and wonderful people. I cannot continue without first thanking this beautiful Nantucket community for allowing me to be a part of it. I thank all the organizations for making me feel welcome in each and one of them, which I have managed to be a part of. And I have been able to share a little of what I am and what my community needs. I am proud to have been a part of organizations where they care about doing the things that the people need because they understand that we are an island of immigrants and we come from all over the world with different nationalities. And they understand that each one has different needs and they want to make sure they do the right thing, and I love that. I also need to thank the representatives of the island to their sensitivity and great work and their acceptance of me. I know that the key to a safe community is a good government. I think we have it here because I have been able to meet each one of them. I see their great hearts. They have shown me their affection, their commitment, and I know they went to work with the Hispanic community. And I know that there is much to do and they are trying. I am grateful because they have a lot of patience for us. They have been working very hard so that all this community is safe, especially in this pandemic. I want to thank the organizations that have put themselves to work hard to help the most valuable people, vulnerable people who have lost their jobs and have had to stay home to take care of their families and themselves, and this way to be able to protect others. The great work of these organizations is enormous and key to being able to stay at home. Thanks to all the volunteers who take the time to help others. Big thanks to the nonprofit organizations and all the donors. And thanks to everyone for wanting to have a beautiful and safe community. Thanks to all those who have supported and loved me. My family and my children, I love them very much. I invite more Hispanics to get up and start giving back to their community, and that we are already a part of it. Thanks to all those who go beyond their work and their responsibilities and dedicate themselves to advocate for others and do more. Even knowing that they can be harmed and perhaps they will not be well appreciated. Thanks to them for being fair and with a noble heart. Thanks for the people who have given me support and shelter when I most needed. And to my parents who taught me that giving was good. I know that there is still much to do, and a little by little, it will be achieved.
Thank you, Mom. Thank you, everybody. Thank you, Jason.
Thank you, Maria.
Lisa, Brooke, Moore. Thank you, everybody, for really, this makes a big difference on people that want to give back. Thank you.
Thank you, Maria.
Thank you, Jason.
Congratulations. Thanks, Maria.
Thank you.
Thank you so much, Maria. Thank you for coming on. Sorry about the wait.
Thank you.
Anybody else want to say anything with Maria?
Congratulations.
Felicidades, María,
Hi, Roberto.
por el trabajo que estás haciendo para todos.
Es difícil. It's very difficult for everybody. So keep it up.
That was very well written. Congratulations. Your daughter presented beautifully.
I couldn't do it without her. And Mia there.
She did fantastic. Thank you. Thank you so much for coming on.
Thank you. Thank you. Be well.
you guys well as well. Okay, next for announcements, we've got, this is going to be on for a couple weeks. We have a traffic direction change pursuant to the board's vote on October 21st. It's a section of Center Street from India to Hussey. That is designated, it will be designated as one-way northwest bound. The two-way section will remain between Broad Street and Hussey. That all sounds kind of complicated, but there's a map online, and this will go into effect on December 8th. We have a committee appointment for a vacant roads and right-of-way committee seat scheduled for December 9th, and the deadline for applications is Friday, December 4th. And we do have a couple of announcements that came in after the agenda went out, which I will read. The airport has a public information session this Friday, November 20th, starting at 5 p.m. A presentation will be provided to update the public on the PFAS investigation and remedial actions currently underway at the airport. Public questions and comments will be addressed, and there is a YouTube link online. If people want to participate in the meeting, they should register to do so. And again, that is online, and there is a place to submit questions or comments before the meeting as well. Next, I wanted to have Chief Pittman make a brief announcement about firearms permitting suspension. Chief, is he on?
He's on as a
The
participant.
chief is on as an attendee, so let me allow him to talk.
Okay.
Thank you, Erica. Thank you, Libby. Let me just start this by saying what you witnessed happen today here at the police department was a new practice that we put in place after the George Foreman incidents, in which any employee of the department that witnesses something that's unsafe or improper is allowed to bring an immediate stop to that action. In this particular case, our permitting window people determined that it was unsafe for them to continue to fingerprint applicants for permits and licenses that require a fingerprint-based criminal records check. An example of those permits would be licenses to carry and firearms ID cards. Now, this action was taken after employees responsible, so we suspended accepting those applications until we can resolve the issues that they brought up, which I think we can resolve them. It's just we just have to look into it. These employees responsible for obtaining these fingerprints expressed their concern that they could not safely do their jobs with the workplace safety procedures that we have in place. Because of the processes involved in obtaining these permits, it is impossible to do while following state guidelines for social distancing in the workplace. Nantucket, as we know, is experiencing a significant increase in the number of daily COVID-19 cases and expects to see this situation get worse over the next few months, according to health department officials. We have an obligation to our staff and to the community to take whatever precautions are necessary to protect their health and safety, especially during this pandemic. While we all want to think that Nantucket is unique, we are not unique in the way that COVID impacts us. If a staff member becomes infected and exposes an entire shift of police officers to COVID, we're required to quarantine for 14 days, who will we call for backup? There simply is nobody. For this reason, we must take whatever steps are reasonable and in some cases more extreme than what is generally done in the mainland communities possible to protect our public safety staff. We have a state-of-the-art police facility. However, nobody ever conceived of a pandemic creating this type of problem. We believe that in the interest of safety for our employees and the community, that it is best that we suspend accepting these types of applications until we can identify solutions to make the process safe for everyone involved. This move is not without precedent. We suspended accepting such applications early in the year when this pandemic first started, and non-essential personnel were required to work from home. We resumed accepting these permits on July 14th after implementing what we believe to be adequate workplace safety procedures. However, at the time, the island was not experiencing many, if any, cases of COVID. That has changed, and after listening to our employees, we agree that their concerns are potentially valid. While we don't have a specific timeline, we are committed to seeking a solution to this issue and hopefully be able to resume accepting applications requiring a fingerprint-based criminal records check soon. Once again, this suspension only applies to permits and licenses that require a fingerprint-based criminal records check. All other permits are still available at the permit window located at 2 Fairgrounds Road. Does anybody have any questions?
Just a quick comment. I spoke to one of the people that was concerned about this issue, and they completely 100% understand keeping your staff safe. So I think, you know, you're on the right path.
Thank you. Appreciate it.
Jason?
Chief, who will this affect the most? And can they still get their permits somewhere else off island, or is it just more of a burden, or we have to wait for a while?
No, that's entirely unknown at this point. Generally, if a local jurisdiction, and we're not the only ones in the Commonwealth that have done this. There's many police departments that back when this first started, they stopped accepting them. Licenses for applications for firearms, period. Generally, what happens if the local jurisdiction won't issue the permit, then it goes to the state police. But it's my understanding the state police may have suspended it as well. But, you know, I think it's important to know that the governor's orders gave communities the leeway to delay applications for permits and things like that to what's reasonable. And I think it's reasonable for us to be able to put in place some you know, better precaution or protections for our employees. You know, I don't know what those protections are. We're kind of limited. You know, that area wasn't designed very well for this purpose. It was designed well for getting permits, but it wasn't designed well for protecting people against COVID or other diseases. So we may have to make some, you know, slight structural changes, or we may have to obtain some equipment. Maybe it's as simple as getting a different type of PPE. I'm not sure yet. This just arose today, and I haven't had a chance to get really deep into it other than addressing the many questions that have come up.
Thanks, Chief. I support it. Just curious.
Oh, Jason, I didn't answer your question. It mainly impacts people applying for licenses to carry or firearms ID cards. It could also apply, it will also apply to people change a manager, although it's only a local requirement that we do that check. The license to carry, there's a state requirement that we do that check before we submit the applications to the state. So I think the primary impacts on the license to carry people. Secondary impacts going to be on change of managers and taxi cab operators, I believe, but we actually suspended that at the beginning of the pandemic and didn't start that again.
Thanks, Chief. Next, David Gray has some great news to announce about some staff certification achievements. David?
Good evening. Thank you, Libby. Yeah, I'm very proud to announce, I probably sound like a proud dad, but it's very exciting. Since October 10th, I've had 5 different operators successfully pass their Massachusetts wastewater certifications. Tacky Gordon received his grade 4M wastewater certification. David Richards had passed his grade 6C certification. Osaji Doyle has passed his grade 6C certification. Sean Reed has passed his grade 4M certification. And Mark Dwyer has passed his grade 6C certification. This is some very incredible activities, and they've done such a great job. And just to give you a little idea, the Mass grade 6 combined license has a passing percentage of only 18.9%. It's over an 81% failure rate, and the grade 4 has a 37.5% passing rate. So these guys did an incredible job. I am so proud of them all, and I just wanted to let everyone know that everyone out here is doing their thing, and I have 4 more operators going off in the next couple of weeks for licensing. So it's been really good. I'm very proud. And then I did have just another quick a notification of some construction work that's going to be starting right after Thanksgiving. It's called cured in place pipe relining. We're going to be doing a lot of lining in town streets that doesn't require any excavations. There is going to be, however, some odors involved with this process. And we are going to do everything that we possibly can to knock on everyone's door, get flyers out, get some notifications up on the website, especially within lieu of what had happened recently in the past weeks. We don't want to have any confusion or people calling about any odors or smells that could be what we're doing for work. So we'll be around the island. I will let people know where we're going to be working so you can witness this kind of technology. It's never been done on the island before, so I'm really looking forward to it. No paving involved, which is really good. That's it, Libby.
Thank you very much, David, and congratulations to your staff. That's fantastic. I think that's it for announcements.
Thank you. Next up, we have our COVID-19 weekly update. Are there any opening public comments? If anyone wishes to speak all the way through, just raise your hand. I'm not seeing any hands at the moment. So I will turn it over to a report from our public health director.
Thank you. And I'll, as usual, share my screen, doing something a little bit different today. So hopefully it works. All right. So here we go. I changed the format a little bit because there are some pieces of information that are no longer available from the state, mainly like the map of all the red colors and things like that, because at this point, almost the entire state is red. So you'll see a few changes here. I also took out some of the graphs, all of the graphs. So we'll go from here. So real quick, testing as of this yesterday, we did 14,185 tests, including both our OIH and Sherburne. But what we're seeing is that there's a certain current surge across the entire country, but also in the state using the Broad Institute. So our samples are taking a little bit longer than normal, sometimes up to 48 hours after the sample was taken. So we just request that people be patient. But new guidance has come out from the state, which I did also forward to the hospital, and the hospital already had it, regarding quarantine while you're waiting for your test results. So we'll get that out on social media as soon as possible. That came out today. So real quick, an overview that we did have a significant spread, and you'll see these three numbers are a little alarming. Usually that 10-day caseload is the highest, but what we're seeing here is that over the last 30 days, we've had over 130 cases. 100 of those cases were in the last 20 days alone. So we're in the midst of it. But what's really important to see, and I'll get to it later in the presentation, is that actually, in comparison to the rest of the country and in the rest of the state in general, we're actually still doing surprisingly well. So what's really important here is just how does it spread? If you watched the Thanksgiving presentation that I put out, you may have already seen this animation, but let me go through it today. So represented here are 4 households of 4 people in each household in pod, and you'll see the numbers 1, 2, 3, and 4, and that same numbering system goes for all 4 pods. So if person in household 1 or pod 1 gets infected, and they end up bringing that whole infection home. So about 2 days later, all of pod 1 gets infected. And then if pod 1, person 1, say goes to a game night with pod 2 of person 2, but also has lunch with pod 3, person 3, well, now both of those people are infected. And then everyone in pod 2 gets infected 2 days later. But the good news is in pod 3, that person was found through contact tracing, properly isolated from the rest of the household. Well, now no one else gets infected in pod 3 because of all their wear masks, hand washing, isolate from the rest of the household, using the CDC guidelines. No one else in pod 3 gets infected. But unfortunately, person 3 from pod 2 decides to go to work with the person from pod 4. So that's that person, and then a person from pod 4 also goes to work. Now, pod 4 gets infected. And then 2 days later, all of them get infected. So what we're seeing is up to about 12 people were to get sick because these individual households and these individual pods start interacting with each other. When you hear from CDC, when they talk about the pods, when they talk about isolating together, this is what they mean. Those 4 people from each pod have to stay among themselves. When they don't mean that so-and-so, my friend from 3 houses down, is part of my pod. That's not true because they're not living with you. So as soon as you go to that person's house for dinner, for lunch, for a game night, you've now crossed the 2 pods together. So now that those 2 pods of 4 become 1 pod of 8. So if one of you gets sick, all of you can get sick. So that's what's really important. That's what we're seeing here on island, where people who aren't necessarily quarantining or don't necessarily know they're sick yet sometimes end up getting everyone in their household sick. So moving forward with our current metrics, you'll see a little bit more yellow than what we've normally been seeing. So in our positivity rate, we had 5.7 over the last 7 days. Using even the state numbers, we hit 5.1. So we will be going red tomorrow in the state metrics because we've had more than the 30 cases per 100, more than the 10 cases per 100,000. And now we have a positivity rate of over 5%. So we will be going red. So what else here? The big one is the healthcare system readiness. What's really important, the reason I put that in yellow, is that even though we're still okay here on Nantucket, we are still able to get people out to MGH and MedFlight. There's already a field hospital being erected in Worcester, and Boston has been moved into a standby status for their field hospitals, which if the hospitals on the mainland get full, we have nowhere to send our people. So it's really important to pay attention, which is why we're asking to pay attention to the Thanksgiving guidelines that are out there. Don't travel. Please, just don't travel. As awful as it sounds, virtual Thanksgivings are probably the best way to go this year. This is what we see this year. This is what we've seen this year since March 16th. And that's starting to become a pretty steep curve because we're seeing pretty consistent numbers coming up, over 100 in the past month. So in the past 20 days. So that's what we're seeing here. So over the last 30 days, you'll see that we went from, we went from just over 150 all the way up now to close to 300. So that's kind of what we're trying to get across. So as far as the sewage metrics, we didn't receive I haven't received the newest ones, but they should be in tomorrow. But what we're seeing is we still have this spike, and I forgot that this is PowerPoint now. We're seeing this spike here where it's still going up. So, and they're still looking at around average of 10 cases per day, which in the past, in last few reports, report has been spot on. So we're on our way. So we do really need to pay attention, but we are, I keep wanting to reiterate this, we are still doing pretty well in comparison to the rest of the country and the state. So when we talk about flattening the curve, we are still seeing relative one-to-one transmission. So you see the trend line, which is the dotted line going through it, even though it does look like it's going up, slope-wise, which is the R number, is actually pretty steady. So we are seeing more cases per day, but as far as the R number is concerned, it is still pretty steady. How steady? Well, we're still only seeing an R number of 1.14, which is surprisingly low, which is when people are talking about it, they say it looks wrong, but it is surprisingly low. And let me explain. So when you look at the visualization of the trend line throughout the entire outbreak, everything from March to today, you'll see that there's a hovering of one case per day across the first few months. And the reason you see these large gaps, 316 to 323, 330, is because we were only seeing about one case every week. So when we were first started the spreadsheet to collect the numbers, we weren't doing day-to-day checks, which is what we're doing now, which is what you see up here. But what you see is just in general, this trend line tends to, there's little spikes, which we're in this middle of a spike now, but they do tend to hover lower. And when we connect to the state's R number is 1.22. So even though we are still in the highest spread, the fastest spread, and that's by number of population, by population percentages, it is still a relative one-to-one transmission, which slows down that infection rate, which is why at this point of last year, I would say last year, but at this point last year, we were COVID-free. At this point back in March, you'll see that our number was a 2.5, which is why we saw hospitals filled, which is why we saw people dying, large amounts of people dying in hospitals because they couldn't get to the ICU, because they couldn't get onto ventilators. What we're seeing here, even though the R number is 1.2 and we are seeing high numbers of infections, that high number of hospitalizations is not what we're seeing. The curve is still flattened enough that we can still respond. So that's the biggest takeaway that we're seeing here, that even though we're seeing big numbers, you'll see 14, 12 once in a while, it's still a relative one-to-one transmission. So when we look at the holidays, where are we? How do we avoid it during the holidays? Well, don't travel to celebrate with your households. Wear a mask, stay 6 feet away from each other, from others in your household. And it is okay, even if you do go to see somebody else, it is okay to bring your own food, drinks, cups, plates, napkins, because that way you're minimizing your exposure in other people's households. And if you are going to have a large gathering of family from different households, please consider having only one person preparing, plating, and serving the food. Because if you do it a buffet style, that's how you get a lot of cross-contamination of serving utensils. If one person is putting all the plates, only one person is interacting with those serving utensils at a time. And I just want to end it here. And real quick, I want to give a quick general idea of how it is spreading here on Nantucket. This is something this is an actual outbreak here. This was the early sections of our outbreak now. So what we saw was that 6 people in one work area ended up getting sick. Of those, they spread it to 5 others. Those in blue are people who quarantined, isolated, and never ended up passing it to others. In one case, they only passed it out to one other person. This person passed it to one other person, and this one too. And they ended up they isolated and quarantined, and the spread stopped there. But with others, this one person was also created a whole new branch of the outbreak, which was 1, 2, 3, 4, 5 other people. In this case, one other person brought it home to an entire household, which ended up saying 1, 2, 3, 4 in the next generation. The generation after that, 3, 4, 5, 6, 7, 8, 9 in the generation after that, and then so forth in this lower generation down here. So this 4th branch or 5th branch that you see down here, it's what we call the F1 generation. This is the spread that we're seeing today. This is actually the branch that we're seeing in the 12, 14 cases that we're seeing. This is now we're about 4 generations in. So that's really important. That's the visualization. And we will have all of this up on the websites and social media now. So I will stop sharing so that we can see each other. And then I guess I'll throw it over to Gary before we go back to questions.
Thank you, Roberto. As I always do, I want to just say that's a great presentation, good information, and it helps us think about what we're facing and the work that still needs to be done. I just want to reflect back to Roberto's comments about the risk that we're facing. Obviously, we know it's real. And I want to also emphasize what Roberto had said, that compared to the rest of the country, we're doing relatively well. There's great work being done in the community, great support being given to one another. But my concern is, as we move into the holidays, we have the opportunity to create denser households. And what we're facing right now is coming from dense households that are honestly impacted greater than non-dense households. So that's a concern about the holidays. So obviously the travel is not recommended, but there are good guidelines out there that if you do travel, how to do it safely and how to protect your family when you come together. The Cottage Hospital remains open. We do not have plans at this time to slow any of our services down or any elective surgeries. We have not had any infections amongst our staffs, and that's great because what we want to obviously do is be able to continue serving the community with all that we might be facing. We have had a few cases in the last few days escalate from minor to more severe concerns, and they were medevaced off the island. Let's hope that that trend doesn't continue, but I was asked by the INCI a few days ago why we weren't seeing hospitalizations or rates of inpatient care requirements that were reflected in the statistics. And I said, that's only because we're lucky. It's not because the statistics aren't real. So we still face that reality that, we can start seeing more people needing admissions for care. And of course, that's concerning. We'd love to help prevent that. The testing here continues to go well through our portico, and I won't repeat the numbers that Roberto put out there, but it's amazing that we've tested almost 14,400 individuals since this has started. That's a large portion of this island, and it's great that we have that testing capacity. The Stop the Spread testing of that component has given us about 1,984 tests. We've only hit the limit of the 75 tests per day that the state's given us to use on 10 days out of 34 days being in the STS operation. And out of that, we found 12 positive. So obviously, it drives a benefit to have testing available. And when we find those 12 or those whatever numbers, getting the contact tracing in place and isolation right away, getting on it quickly is what helps prevent other cases and concerns. Flu shots are also going very well. We did indicate that as we moved into cooler weather that we were going to stop giving flu shots in the accessible way through the portico by this Friday. That's not to say that we're not giving flu shots. Obviously, we'll still continue giving flu shots through nurse visits in the Cottage Hospital. And if there's enough demand, we can certainly start the portico up again. But I know that there are individuals in the community that have expressed a desire to get their flu shot later in the season. And this week we have seen that as we put out an end date to this increase significantly. So as of right now, we're at 4,833 flu shots that have been given, which is fantastic. That's through all of the time that we've been open. So Thursday and Friday are the final days for the drive-through. Of course, that's from 12:30 to 4:30. So please come get your flu shots. We'd love to see you. You certainly don't want to have COVID and the flu at the same time. So that would be it on the front of the numbers. I will say and echo what Roberto is that I know that as a community we're doing good work, and I know that we have an ability to beat this, but I am very concerned about the holiday season and what that could mean if we pack homes with people and let ourselves drift. So I'm asking the community to be extremely diligent and careful. Obviously, the impact is for individuals that get sick, but we don't want to have the hospital get to a point where it can't provide services and has to consider slowing its services down. And we run that risk of a concern as we get into numbers that are showing up like we have. So let's do all that we can to knock this curve down to something that is manageable. I believe it is manageable right now, but we just need people to be diligent and careful.
Thank you. Does anybody have any questions or comments? Christy?
Thank you. I have two questions, one for Roberto and one for Gary. With the new state metrics, Roberto, that changed since we had our last select board meeting. So I don't know if you could go over that a little bit. I know we dropped into the yellow for a little bit. And then just my second question for Gary, with 14,000 tests, with the size of our community, is that kind of on par with how many tests others are doing? Are we doing more, better or worse than other communities? So I'll let both of you answer. Thank you.
Sure, Christy, I would say that from the testing perspective, from how many people we have in this island, how many tests we've done, we're way ahead of most communities. That's due to the Broad Institute stepping up and giving us some forefront testing capabilities that develop more and more capacity. We're very, very happy that we've gotten that support. So I would say that, there's a good job being done out there with the Cottage Hospital staff staying for those hours and those drive-throughs.
Yes, and as far as the state goes, so let me pull up the state information here. So the way they've changed it out is we have the new graphs. So you'll see Nantucket right here in the middle, new charts, not graphs. So this is last week's chart. So what they do is their total tests, how many tests were done in the previous 14 days, how many positives were done in the previous 14 days. They calculate that to get their percent positivity. And then this was just this is the old calculation they were using, which used to be the way they get us into red, yellow, and green. So for the people watching at home, it might get a little disorienting. I'm gonna quickly scroll up. So give me just a moment. So, and it gets stuck, of course. Internet. So what I'm looking for here is the chart that actually explains the new metric, which is usually at the beginning of these. But if you notice, these are all the towns in this state. Most of them are yellow. Many of them are red. A significant portion of them are red, actually. So gray also just means that sometimes they don't have the information available. And of course, I can't find it. So that's just the way it always works, isn't it? But in the meantime, what we're seeing for tomorrow is Nantucket. We had 1491 equals. So that's what we had for how many tests, and then we do. So that's a 5.2% positivity rate so using the chart for tomorrow, we're most likely going to end up in the red. So this is they send us this spreadsheet the day before the calculations get done. So, and then once I'll pause sharing right now until I find that stupid chart so that I don't get people sick, and then I'll go back to it.
Jason had his hand up, then Matt put his hand up, and Brooke Moore has her hand up. So let me go through in that order.
I just wanted to thank Roberto for the visual of how it spread with those 6 people. And I think people need visuals like that to really see, like, this person quarantined and it stopped and it didn't go further, and this over here didn't, and just how I thought that was really good. And I really appreciate putting those things together. You would think that everybody gets it by now, but we need to keep educating and putting these type of visuals out. So thank you.
Multiple ways of showing the same information is usually the best way to show it. I found the chart. So right before we move to the next person, I'm sorry, Don.
No, go ahead, please.
Really quick, explain what it is that we're seeing. So this is the calculation that they use. So we fall under the middle column. So the reason we've been staying in yellow is because we have this population. We have been having more than 10 average cases per 100,000, but our positivity rate has been below 5%. So what you saw in the Excel sheet is that we're now going to have a positivity rate of 5.1, which just edges us over into the red. But as soon as that positivity rate goes back down below 5, we should be able to drop back down into the yellow. This is on the state's dashboard. This is on the state's dashboard, and that is available at mass.gov, and they come out with it every week. Tomorrow's will be out at, I think they said 5 p.m. So look for that chart tomorrow. And then I know Brooke had a question.
Thank you. Well, Matt had his hand up, and then I'll go to Brooke. If that's okay.
One was, my first comment was the same as Jason's, that chart was very helpful. We can talk about pandemic math, or I describe it to people like compound interest, but a lot of people don't understand those concepts. But seeing a sort of, a Christmas tree, on the right side, and seeing one person turned into 16 or whatever it was, that's that's what we don't want. One time, it's like doubling a penny. Do you want a penny and double it every day? That's what we want to avoid. And I think that was very good. Question I've had it for a couple weeks. Do we have any segment that's being tested regularly in our, in our testing, like those numbers? And the reason I'm asking it, because what the state found was they started testing colleges, and then a lot of those kids that were doing the right thing, especially professors and some of the grad students, they were making the numbers look, lower because they were doing the right thing and getting a lot of tests. So they stripped those out in certain communities to get a true look. So do we have anything like that we have people regularly being tested who are counting as sort of, bringing our positivity up or down?
So yes and no. That's a little bit harder. So yes, we do have people getting regularly tested, which is like OIH, things like that. They get tested on a regular basis. However, all our tests results that get sent to the state, they actually deduplicate so that they don't accidentally put the same person in twice. So that's actually, so that when they're calculating the numbers, even though that number goes up, it's saying 1,400 tests in the last 14 days, that has already been deduplicated from people who've been tested multiple times. So if the same family, same family of 4 gets tested 3 times, those are 12 tests, but they will bring it back down to just the 4 at the state level for our calculation.
So they've stripped them. They've only count them once, no matter how many tests.
Exactly. So if you look at the state daily dashboard, there's actually an entire chart that they dedicate to that, specifically saying, this is how many tests are done, but this is how many individuals have been tested in order to remove that in order to create that deduplication.
Thanks. I'll go to Brooke, and then Melissa. Erica, can you let Brooke Moore in? Oh,
there we go. The invitation to unmute came a little slow. I have a comment I want to make, which is that the timing of the phone call upon a positive test, there may be some misunderstanding in the community about how quickly one gets a phone call if one has a positive test. And I'd love Gary and Roberto to talk to that. And then the other thing I'm curious about is the collaboration between local and state contact tracers and the effectiveness of that. I think there's some confusion out there that could be clarified. Thank you.
Who wants to take that?
Take it.
Thanks.
I'm just gotta take a deep breath on that one. So what's happening here is if the positive test comes back to us, and we have the capacity to do that contact tracing, the person at our hospital, Elizabeth Harris, is very fast at getting contact into people. She deserves a medal for what she's been doing. Or Gary, one of the challenge coins. She deserves unbelievable amounts of praise. And she's been getting in contact with everyone within 24 hours when she has capacity. As soon as, sometimes we get our positive tests results at 8, 9 o'clock p.m. So though it will show up on your patient gateway as positive, at least allow the contact tracer to get in contact with you if we still have the capacity. However, sometimes if Elizabeth has to be out for a day or two, or if we just get 14 cases in one day and 10 cases the day after that, we have to refer a lot of them to the state contact tracing collaborative. And that information is only, it gets out to, it refers to them after that 24-hour period has expired. So they automatically pick it up at that point. So, and then the contact tracing collaborative is also handled in little silos. So the Cape and the Islands has a small team of contact tracers. In some of the earlier parts of this particular surge, which is probably the example you're bringing up, in one of the situations in this particular surge, we had a situation where our in-house contact tracer was out. We referred it to this. We referred those cases to the state, which was 12 cases that day. And then the contact tracers on the Cape side actually ended up getting something like 50 or 60 cases brought to them. They weren't expecting that same amount of surge, so they fell behind. So some people didn't get a phone call from the state until about 72 hours, maybe even a little bit longer after that. But what is happening and what is consistently happening here is that on average, by and large, almost every single one of our positive cases received a phone call within 24 hours for contact tracing. Gary, did I miss anything?
No, I think you said it clearly. It is a challenge. But we do also, in addition to that, we do have other individuals in the cottage hospital that will back up Elizabeth when she's out. It just depends on the numbers that we get. So there's a good focus on it.
Sorry. Thank you, Gary and Roberto. But Brooke, did that answer your question? I just saw your hand is still up.
Yeah, I wanted to say thank you, and it was not meant as a criticism. I think it's just that managing expectations is really important, and I appreciate the answer, and I know it's a really, really difficult task, and that I hope you didn't infer criticism from what I said. I was just curious for the information. Thanks.
Not at all, Brooke. In fact, any questions, observations are welcome. That's how we get better together. So thank you for that.
Thank you. Melissa, did you have a question before we move to the next item?
I did, just quickly. I know we talked about it very briefly, but I am aware that there are some community members who are planning to travel for Thanksgiving and or have people travel here. What is the best guidance for testing or retesting or isolation? Can we just review that clearly for people who are planning to travel for Thanksgiving? And I also know that the return of college students, Governor Baker spoke about that today. There are a number of families who are bringing their children home for the holidays. What's best practice in terms of testing for those individuals? Thank you.
There is some information that was sent to me this morning. So to give you just a moment, I'll be able to pull that back. But in the meantime, I know that the hospital has pushed out some of the Thanksgiving information, and there is some really good information on that. But if you give me just a little bit, I'll have to pull that up from what I got in the state this morning.
So Roberta, while you're looking, so Melissa, if you go to our hospital website, we did put a pretty comprehensive overview of, safe travel and what that looks like. From a testing perspective, I think what Roberto is going to refer to is what the governor's requirements are for testing. And of course, the concern is it's only as good as the day that you take the test, and it's only as good as the amount of time that you've had from an exposure. And what we know is typically an incubation time of 3 to 5 days. So, traveling and testing the next day, well, I'll refer to Roberto for how you'd want to frame the testing environment. Roberto.
For the sake of brevity, I'm not going to go ahead and go through my 100 emails that I got today. I think so. What the governor was saying and things like that is just that try to test within the 72. I mean, within 72 hours of traveling. If you come back positive, especially for the college students, there's 2 separate guidances that the governor released today, one for college and one for the general public. If you come back positive, you please quarantine at home, do not travel, isolate at home. But the one other thing, but for the college students, if they come back positive, they need to isolate in the COVID dorm on campus, and they need to be there for the 2 weeks. They do not travel. So that's very important for that, for people watching, that if they have family coming home from college, when the colleges are offering their free testing for their students, that's a state mandate. If they come back positive, they are supposed to quarantine in the dormitory on campus for the 14-day period. And I keep saying quarantine because that's the word everyone hears, but the true word, if you're positive, is isolate. You quarantine if you got exposed, you isolate if you are positive. And then as far as going into other households and things like that, just because you got a negative test doesn't mean you're necessarily COVID free. You could have easily picked it up within the 48 hours or even the 24 hours or even on your way to that person's household. It is still possible. So that's why our recommendation is please just stay home. Please don't interact with other households. It just increases the risks to a level that we hope we never reach. But we will be posting the Thanksgiving guidance-led documents and the state's quarantine and isolation documents as well on our website.
Thank you, Christy.
Thank you. Just a few more questions. It's been 2 weeks since we met, so I feel like I had a lot of questions saved up. When there are cases in the school, how do we go about contact tracing? Does everybody in the class have to get tested, or are we doing that 15-minute rule? And I'll let you answer that one. My second question is a little more winded.
So with the schools, it's a little bit different. So as long as they're following the protocols, which is why we get in contact with the schools each time, with the school nurses, and they are agents to the Board of Health for this, so we can share information freely. So as long as the proper protocols were being used, the other students in the classroom are not considered close contacts unless they were within that 6 feet distance. So there were a few situations here and there, especially in one of the sports programs, where a couple people were considered close contacts. So we did end up having to shut down that sport for a little bit, and then they all ended up getting tested. Only one other person in that sport came back positive, but it actually turned out that they were related, and they had been at each other's house within the previous few days. So, and then today the governor is released in his informational release today. He was talking about how they're going to be rolling out a rapid testing program for the schools. And if things go well, we should be able to get that. So if a person has any sort of symptom or something like that, they can do the rapid test, which does have a high false negative rate, which is important and it does have a high false positive rate too. So if the rapid test does come back with a positive, you do still get referred to the local hospital to get your PCR test done as a second confirmatory test. We don't know what the timeline will be on the rollout of the rapid tests, but we're hoping it'll be soon. And it'll speed up that sort of contact tracing because we'd be able to test the entire classroom.
Thank you. And kind of more of a comment than a question for my last thought is just trying to figure out how to increase testing. And a lot of what I've heard over the past couple of weeks is people are really scared. They're scared of the virus. They're scared of losing their job. And they're scared if they get tested, they might shut down, their work site or, shut down the island and other industries. And so just trying to put it out there for ideas from the board or Board of Health of how we can really encourage our community to get out and get tested so that we can try to contain this as best we can as we move into the holidays. So thank you.
Thank you, Christy. Next up, Libby is going to talk about enforcement, education, and outreach, which might be helpful. for the continued discussion.
Thank you. So just a few updates. The EOC, the Emergency Operations Center for COVID, was convened on Monday, this past Monday, the 17th, to discuss the nature and recent increase in number of cases. We're meeting again on Friday. We will continue to meet as needed. The outcome of our Monday meeting was as follows, and I meant to get the board to sit rep on this, and it just never got off the ground. We are working to develop a program to engage temporary inspectors who can conduct inspections and provide education and enforcement as necessary. We have reiterated and reconfirmed current town staff conducting random and frequent inspections. These are health inspectors, building inspectors, natural resource officers, and Nantucket Fire Department staff. We are working to task the Council for Human Services to come up with recommendations for ways in which to house, get resources and assistance to those who may need to isolate and or quarantine outside of their homes or at their homes so that they do that instead of going to work. We are holding a meeting with the Nantucket Builders Association tomorrow as a representative group of an industry where cases have been identified to re-review safety protocols, as well as ensuring that their employees are not in any way forced or urged to work when they're infected and should be quarantining or isolating. We're working on how to schedule a meeting with the landscape industry. We're keeping in touch very frequently with the Nantucket Cottage Hospital as to when or if to increase testing. We are about to issue updated COVID-19 workplace safety guidance to town employees, including holiday travel guidance. That will get out before the end of the week. We are finalizing a written enforcement plan. I sent it to the board just before this meeting. Look it over, let us know if you have any comments. Meanwhile, other things that are ongoing or have started or are about to get done include the Sub-Emergency Operations Center, which includes myself, Roberto as the public health director, the police chief, the fire chief, and the emergency management coordinator. We meet once a week. We've been doing that since June to discuss outreach, education, enforcement, cases, other issues that come up that need to be addressed. In discussing with our colleagues in other towns, both Roberto and I have been doing this, what they are doing, we find that Nantucket seems to be doing much more than most other towns with our outreach, including videos and other messaging in Spanish and English. Some other towns are doing a lot as well, but Nantucket is among those that are doing really what we find to be the most. Our sub-EOC group reviews, researches, and responds to inquiries. And some of those are various ideas or suggestions that come in. One of you had an idea to establish a communications work group to help determine what additional outreach, messaging, and or education can be done. We're going to work on that. The town website COVID page has more than 500,000 hits since March. And at least one of us tries very hard, and I think we're pretty successful, to regularly attend or watch the governor's press conferences. There are Department of Public Health calls twice a week and Mass Municipal Association calls with the Lieutenant Governor. Those were once or twice a week. They've tapered down to about every 2 weeks. And on one of the Department of Public Health calls this week, they referenced a question that came in from Nantucket. And that was, I had it on, I was listening to it, I heard Nantucket and I perked right up. We also have 2 video campaigns underway. One is through the town, and what we're hoping is that people will send us in videos, short videos. What are you doing for safety protocols? Anything interesting, anything fun, or just, send us a video of you and your family with masks on, whatever. Through the hospital, they are also working on a COVID-19 stories video campaign, and that's underway as well. So we have a lot going on. Obviously, we're always ready for more suggestions. And again, a lot of the suggestions, not a lot, but some of the suggestions simply are not feasible. So they're not going to work. And people say, oh, well, you're just throwing up obstacles. Unfortunately, that might be a perception, but it's also reality. So those are just some of the things that are going on with regard to COVID in the areas of education, outreach, and enforcement. I don't know if you want to add anything, Roberto, or anybody else of the team.
I think you really nailed it. One of the things that really is coming out of a lot of things, Gary and I have joked about maybe writing a white paper about this, publishing something, because really the approaches that Nantucket has taken are truly unique, and we're way ahead of the curve on so many of what we're seeing across the country. So I think we don't toot our own horns enough when it comes to that, and Nantucket is really doing something that most cities and towns in the United States just aren't doing. So we should be proud of the work we've done.
I'd just like to say, in sitting in on the EOC meetings, which are not public meetings, but for the public, I'd like them to know how thoughtful the leaders of the town and the community have been, and how well informed, and how much is truly being discussed on ways to combat this for the community. And that, it's the top officials of the town and the hospital have been in conjunction from the beginning, and continue now that things have gotten worse again. We've reconvened on a regular basis. And I want to thank Roberto and Gary and Libby and all of the others that have been involved. Public Safety, Chief Pittman, Brendan Coakley, for all of your work on this. You were tireless in the beginning, every single day, including weekends. And are really, everyone's putting their heads together on what more we can do.
Thank you, Madam Chair. I just want to mention who's on the EOC. So the EOC that is going to has sort of reconvened is Police Chief, Fire Chief, the Emergency Management Coordinator, the Public Health Director, yourself as the Select Board Chair, the Nantucket Cottage Hospital President, the Assistant Town Managers, and both of them, and our Public Outreach Manager. And yeah, so.
Thank you for making sure we recognized everybody. I didn't get all of them.
Well, just so people, just so that we say EOC and then people sort of say, well, who's on there?
Yeah, and those are internal meetings, so people don't have the benefit to see the full extent of the discussion.
Yeah, I have often thought about issuing the, when I have done a sit rep, a situation report, to put it online. The trouble is sometimes there is internal information in it. I guess I could clean it up a bit and post it, but sometimes by the time I get to it, it's already out of date. So it's really hard to keep it up. And there is a daily state. Well, it's not so much daily anymore, but there's a regular state one that is available online.
I just wanted to illustrate for people that there really is a task force that is convened, that is working tirelessly on this on their behalf. Melissa?
Thank you, Dawn, and thank you for that update, Libby. I do think it's really important to remind the community that the EOC meets, even though we don't talk about it all the time. And I was the board member who suggested that perhaps one way in which we can continue to support the efforts of the EOC and administration is through some additional communication support. And I think that idea is born really from looking at the forecast of the winter, knowing that the spread of the virus is likely to get a little bit worse before it gets better, that we're going to be facing different challenges than we were facing in the spring, and to also just acknowledge that this staff has been working tirelessly. I know that's a word we've used a lot tonight, but since this outbreak occurred 9 months ago, and I want to make sure that we're creating systems of support that can help advance that work, and that to the best of our ability, we avoid burnout or fatigue. And if that task force can be supportive in that way, that's my suggestion, and I think the goal. So I want to be clear on what that suggestion is born from.
Thank you, Melissa. Gary Shaw?
Thank you. Well, in all of this hard work, it's designed so that we can have a long-term hope that we can get through this. And I just want to highlight that you're reading now in the media that there are a number of vaccines that are promising, have come forward, might be applying for licensing, those companies by the end of this month. And so the work that we've been doing, in addition to just understanding what we're currently dealing with day to day, is planning for receipt of monoclonal antibodies, which could be used in infusion, vaccines, which would need to be administered, storage protocols to be able to receive and have doses available so we can get those to the community. So, oh, happy day when we can look at our energy going into vaccinations that have a 94 or better percent, efficacy rate. And so the work to plan how that will be received and distributed is ongoing and has been going on for a month now, well over a month. So let's look forward to that. But I will ask the community to just consider this as we move into the holidays. The work that you've just heard that's going on is exhausting. And, there's only so many people on this island to provide healthcare, and people are getting tired. Their morale is up. Folks are working to take care of their families, take care of you. They're working hard. We need your help as a community to slow this down, to stop it if we can, but to pay attention and respect those that are trying to save lives and put a better life forward so that we can get to that vaccine and have as many people as possible enjoy the benefits from it. So that's my call to arms, is help us slow it down. We just need to do that very diligently.
Thank you, Gary. Are there any other questions or comment? Oh, Matt?
Yeah, no, I think our communication has been really amazing. I mean, that has been a strength through this whole thing. I think it's our enforcement that needs to improve, and that, and I look forward. I'll read what Libby sent. That would be great. I was surprised at the Board of Health meeting that, the state, some of the businesses weren't following the state guidelines. And there was kind of a discussion and a misunderstanding. Oh, a COVID person has to be here. And, oh, we have to have a logbook. There was kind of a misunderstanding. And I think that, that goes into the part that we need to spend time on. I think we need to communicate that and then go on the sites and go to the places and tell them that. And so that, sort of that's been my sort of focus through this. And I think that you guys have done a great job. And I think sometimes accepting help is not a bad thing. If there are people who are willing to help, we should be listening to that, and taking that in. I did go off island for the first time since February or March. I took the boat over and back, picked up grandpa, older family member that had a operation in Boston, and came back on the boat. And to be honest, it was frightening. I don't think food, if we're going to have, it was a late boat on the night boat coming back. I didn't know it when we sat down, and we couldn't move our seat once we had sat, but one whole floor allowed drinking and eating the whole trip. Some people sat and drank beer the entire trip. So we're in a enclosed space with people drinking and talking the entire time with someone who's, compromised and just out of the hospital. It was frightening. And, we're fine, but I'm worried if that's going to be what people are going to be facing coming here for the holiday. I have some concerns. The blips that we see on those charts all have all followed holidays. They've followed, for the various holidays. 2 weeks later or so, we see something. So we are going into I agree with Gary, I agree with Roberto. We're going into a really sort of uncertain time if people are not going to be careful. And, I had family members calling, oh, what are we going to do for Thanksgiving? And I said, we're not doing anything. If you want to see us, go to Zoom and see us. But we can't put 40 people together at some point and not think that that's going to lead to an issue. And we all miss each other, and we all like to do that. Not me as much, because I'm not that way, but the rest of them are going to miss each other. But we really have to, if you have to think about everybody else and keep your, stay with your family, stay in your pod and not do it. I'm very concerned. Thank you.
Thanks, Matt. I think next up, we have Margaretta Andrews here from the Community Foundation to give us a status on the Emergency Relief Fund. There's, been talk of coming into this quieter time and with a greater surge.
Right. So, yeah. So thank you for the opportunity. I'll just give you kind of a brief update on what we've been up to, the Community Foundation. We opened the Nantucket Fund for Emergency Relief on March 17th, which for all of us feels like a lifetime ago, I know. We seeded that fund with $100,000 from the Nantucket Fund, which is our discretionary grant-making fund, and within days had a $250,000 match presented to us from Remain Nantucket. We started distributing grant checks within 3 weeks. We received another $250,000 match from a faithful anonymous donor in June, and a final match from the McCausland Foundation in July for $250,000 concentrated on community health. All 3 matches were met within weeks, thanks to other generous donors. We have received over 350 individual donations to the fund since March, and we're still getting donations today. To date, we've awarded 133 individual grants to 31 Nantucket nonprofits over 3 phases. Phase 1 were for grants to critical human service organizations which were actively responding to the pandemic, and to organizations which were forced to close but needed to support to open when they were allowed to. Phase 2 was for help nonprofit organizations which provide vital community services to reopen to the public. This included disinfecting programs and PPE equipment, in addition to providing relief and support to individuals and households who were experiencing severe economic hardship due to COVID-19. Phase 3 and our final grants, which was just about 3 weeks ago, were to island nonprofits in all sectors to try and help offset revenue losses that were due to lack of programming and revised or canceled fundraising events. Many of our local nonprofits received grants through all 3 of these phases. Throughout phases 1 and 2, we coordinated a food initiative funded by an anonymous donor and spearheaded by Jean Miller and Carlisle Jensen from our office to match restaurants that were open with nonprofits whose constituents would benefit from a hot meal. Many of our grants went toward this effort, and over 9,000 meals were served to Nantucket residents through the end of June. We hope to get this initiative started again after Thanksgiving, assuming that we can secure more funding. Our executive committee served as our grants vetting committee, and they worked, to Melissa's point, tirelessly. Sometimes 3 times a week we were meeting. We tried to get these grant applications in quickly and awards out as quickly. Now we're kind of as needed, but they did yeoman's duty and vetting these applications and working with our staff to provide the awards. To date, we've awarded just over $2 million in grants through the Nantucket Fund for Emergency Relief, and we have more work to do. We learned just last night that the Commonwealth will be granting $200,000 through a special fund to our community foundation to provide direct economic support for costs related to meeting basic human needs, such as housing and utility support and food security, to impacted individuals and households with incomes at or below 80% of the applicable area median income, and households with no or very limited access to sources of economic relief. We will use this funding and some we have held in reserve to help the island during what we all know will likely be another challenging winter. So that's our update. If anybody has any questions about the fund or the foundation, let me know.
It's great to hear. Thank you.
It's been a very busy time.
Yes, absolutely.
It is honestly, our donors are the heroes, and the nonprofits that are supporting our community are the heroes. We're just the facilitators. So happy to do it, always.
Thank you, Margaretta.
Absolutely.
Any questions, comments, public comments? The last item, Melissa.
Sorry, I just can't help myself, Margaret. I want to thank you so much for coming on. I think it's so important to use this platform to talk about that good facilitation work that Community Foundation is doing and the good work that our organizations are doing to provide services. And my concern is I'm so thrilled to hear that you're getting that support from the state. obviously, is that it's a darker winter. Employment's going to shift for people. Illness is going to affect people. And I think it's so important for us to stay in good communication with you about the support you're handing out or the needs that you see as we need to stay connected to the human services side of this. So thank you again.
Absolutely, our pleasure. And again, we're here to help. And if we need to go back out and do more fundraising to support the community, whatever that need is, we're prepared to do that.
Thank you. Amy Baxter, do you have any licensing updates or anything you need to tell us?
I think I am on later on in the agenda for liquor license fees, so I think I can address most things under that. The only thing I'll say in response to COVID, we have no major updates as far as any new guidelines or regulations that have come upon restaurants or things. But the next thing I think we're talking about and that we're seeing in requests for gatherings and such is the idea of holiday parties and how that looks this year. And that's not going to be the same thing. So as we get towards Thanksgiving, I think that's our next communication point. And as the chamber has done well effectively in their communication is communicating to folks how best to handle these holidays and such, rather than just telling them what they can't do. So that is kind of what I think we're working on right now. But for the rest of it and updates, I will save for the liquor license fee section of the agenda.
Great, thank you. Are there any final board comments or public comments on COVID-19 this evening? Okay, seeing none, I'm going to move on to the public comment for items not COVID-19 related that are otherwise not on our agenda for discussion. This is the time when anyone can bring something to our attention. It's not necessarily for a response tonight, but something that you think that the board needs to be aware of or to address. I'm not seeing any hands. No new business. Approval of minutes, warrants, and pending contracts. Payroll warrants and treasury warrants. There a motion?
Move approval.
Second.
Thank you. All those in favor by roll call. Melissa Murphy.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Jason Bridges.
Aye.
John Holgate, aye. That carries unanimously. And pending contracts. Are there any questions or comments on any of the contracts or a motion?
Motion to approve.
Second.
All those in favor by roll call. Melissa Murphy.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Jason Bridges.
Aye.
John Holgate, aye. That carries unanimously. Next, we have citizen and departmental requests. We have a request from the Land Council for a preliminary review of a conservation restriction to be held by the Nantucket Land Council for land located at 31 Starbuck Road. This is in everybody's packet. Emily Molden is here. I don't know if Emily, you want to say a few words or answer any questions. And this will be just voted to go for final review, and then we will vote on it again at an upcoming meeting. Hi, Emily.
Chair, Emily Molden here for the Nantucket Land Council. I am happy to answer any questions that anybody has. This particular property is located on 31 Starbuck Road out in Nantucket. It is a donation of a conservation restriction that's being proposed to the Land Council. The pre-existing dwelling that was on this property was removed by the owner in 2018, and it will be permanently protected as open space. As I think the select board knows, in Massachusetts, CRs require approval by the state and also by local officials. And so the select board will ultimately need to approve this and recognize the public benefits that are associated with it, which in this case includes protection of state listed habitat and scenic views. It also helps to bring together other open space the surrounding area that's already protected by the Nantucket Conservation Land Trust, and then also has the added benefit of improving coastal resilience in the area. Certainly will help to prevent some of the associated risks of having a dwelling on the shoreline that we witnessed earlier this year at the Potomac Pond Road. So a lot of public benefits there. So I'm happy to answer any questions. As you said, at this point, it's just moving along to town council for further review.
Thank you very much. Anybody, or a motion to send this to town council for further review?
So moved.
Is there a second? Okay, all those in favor by roll call: Melissa Murphy,
Aye.
Matt Fee,
Aye.
Christy Parentella,
Aye.
Jason Bridges,
Aye.
Don Holgate, aye. Thank you, Emily, for your work on this and for being here tonight. Appreciate it. Carries unanimously. Next, request for a sewer connection fee reduction for 16 Field Avenue for the rate effective prior to sewer regulations fee amendments of June 1, 2020.
Good evening. This is Jeff Blackwell. I'm appearing on behalf of Carol Pillion, the owner of number 16 Field Avenue, in regard to her desire to connect to the newly installed sewer line in Field Avenue. Just to give you some background, in 2019, a sewer force main was installed in Field Avenue, and the sewer installation was completed and approved by the sewer department in November of 2019. In order to comply with Board of Health Regulation 69.02A, which requires properties to connect to new sewer lines within 2 years, Carol contacted me in February of this year to help her obtain a sewer connection permit. The sewer commission policy at that time required a permit application fee of just $500 for connections taking place within 5 years of a newly installed sewer line. Excuse me. As everyone else as everyone knows, the COVID pandemic shut down most businesses and offices, including mine, until sometime in May. And just sort of coincidentally, the Sewer Commission adopted a new set of regulations to Chapter 336 of the Common Sewer Regulation. Those were adopted on May 20th and became effective on June 1st. The new fee schedule increased the permit fee to $4,000, except for the Shimo and Plus areas, which were maintained at the previous permit fee amount of $500. And that will extend until April of 2021. I think the fact that certain conditions or areas like Carol Pillion's situation, they were just simply overlooked when the sewer regulations were amended. And I would ask that the sewer permit fee for Carol be set at $500, which is in keeping with the fee established for the Shimo and Plus area homeowners. A $3,500 increase is substantial, to say the least. And I will try to answer any questions you may have.
Board questions? Should we hear from David Gray? David?
Yes, good evening, everyone, again. I did receive Jeff's letter, and this department does take everything under consideration and to heart. This was a timing issue where the applicant had contacted the department, was informed of a potential increase in rates, and then she did hire Jeff's firm to be her engineer for the project. Between that time and when everything was finally submitted, of course, COVID took place, and like Jeff said, everything was closed. We, however, we did maintain office ability to take and accept applications. So there was no inability for us to take any applications. However, other firms were closed because of the orders. Jeff did bring up the fact of the Nantucket Harbor Shimo Plus project. These are two totally separate and different projects, and permitting requirements altogether. So we can't look at the Shimo project and compare it to this project, as they're just two different animals. I did give you quite a, well, my executive summary, of course, is very wordy, as everything else I usually do, but I can go through the executive summary if you want, or we can go through and pick out pieces of it. My biggest concern, and the concern we have here at the department, is of setting a precedence. In our packet, we do show how many permits have already been issued, how many fees have already been paid, and the process that's going to be for us to take and go back into doing refunds, and the other 19 people that have already applied are going to have to get reduced fees as well. And there's some totals in there, and it's not any short amount of money. It's just, and it's unfortunate what happened. And I mean, I've known the property owner for many years, and we all have our feelings about everything. But to go back on the regulations that were adopted in June right now, I think is going to establish a precedence that if we do go back that way, we will need to get a time frame from the board of when do we start with going back to the old regulation fees, or when do we stop? We're going forward with the old regulation fees. It's going to become quite complicated and confusing. But I could go through everything if you'd like, but I don't know if Don, if there's anyone with any specific questions, we can go that way.
Yep, that's fine. Does anybody have questions for David? Do the board members have thoughts on this? Christy, then Jason.
Thank you. Just a question about how homeowners pay for this. Is it in a lump sum payment, or is there a possibility to do a payment plan with the town?
The application fee is usually paid up front in full. The sewer privilege fee or the sewer capacity fee is one that can be put on the taxes and have abatements on it. I am not aware of any payment plan for application fees since I've been here. So I honestly can't say if there is or is not, but I'm not aware of any.
Okay, thank you.
Jason, then Matt.
I think sometimes that we get ourselves in trouble when we do one-offs, because then someone else come in, and I'm fine with maybe doing something here, but I just want to make sure we've thought through, is there a bigger policy that we need to look at? Whatever you said, David, the 19 or 25 other people who kind of fall into this as well. We've done this with other, sewer issues and housing and before. So I think we just need some kind of general, if it's not a policy, some kind of protocol so we can look through the same lens for everyone. Maybe you already have that.
No, Jason, I think this is fairly unique. The timing of everything, just the cards fell in the wrong spots in some of this, and it's unfortunate. My biggest concern is, the property owner did everything right. Jeff's firm has done everything right. It's just the time frame and the dates just did not align. And we have 13 other permits that have already been issued and paid the new fees, and we have 19 other ones pending that we'd have to go back and modify. I'm just concerned about a precedence. It's not without feelings or anything like that we've worked very hard on this, myself and Laura, getting all the documentation together and the timelines. I just can't say enough that it's just a timing issue that hit this.
If I may, Madam Chair.
If we were to make a policy decision to grant this one, there are so many other things that fall under similar circumstances that we would really need to allow fee waivers on all of them.
Yes, it's, or potential rebates of substantial.
Right. Fee
amounts as
waivers
well.
in terms of like refunds.
Yes.
Matt?
You can go to Jeff. I'll speak after.
Go ahead, Jeff.
If I may, I am conscious of David's concern about setting a precedent, but I think that each circumstance is so unique and the timing can be so unique that I really wanted, and I hope that the scope of your consideration is just for this property. Certainly other people could apply on a case-by-case basis, but I don't believe that the commission would be setting a precedent because of the very fact that every circumstance is so unique. I think if you allow people to come to you individually and make their case, you can weigh the timing in the situation and the timing of the installation of the sewer line that has become available for these people. I think in some cases people are applying that do not have, they're not applying within the 5-year time frame of the previous regulation when the fee was set at $500. So I would ask you to just consider this application on its merits and not subject this homeowner to what is really sort of an unfair ruling to apply the new fees to her, and simply look at this as a unique situation and not a precedent setting situation. Thank you.
Matt?
Yeah, first comment, I think I was going to ask David was that we get money from the state for grants that we every couple of years we get some more money. What is that used for? That's for septic and attaching to sewers and things, isn't it?
Oh, yes, it did the loan through the Board of Health. Yes. And that, according to when I talked to Roberto the other day, that can only be used for any of the engineering, the construction, septic abandonment, etc. But it cannot be applied towards fees, I understand. I think Roberto's still on there. Okay.
Correct. The SRF doesn't allow us to use any of the funding to cover permitting fees.
All right, that was the first one. I think people have to, I'm a little worried about precedent, but at the same time, I'm a little concerned because we did have, Jeff and other people were shut for a few months. And so how do you, so I see both sides of that a little bit. I do think people have to realize that even though the fees are, expensive, 16,000 and 4,000 and the different fees we pay, it still doesn't come nearly, doesn't come close to the actual cost that the cost per dwelling for the capacity that we're using at the plant. And so they're still getting at least half, probably more of their costs are being subsidized by everybody else. The tax base is picking it up. So it's a difficult situation because we were undercharging for a number of years, and now we're slowly, getting to where we should be, and it's a burden. So.
And thank you, man. And I got to say, the property owner did the right thing. She had contacted our office. There's a timeline in the packet. And during their conversations with the office staff, they said that the regulations were being reviewed and could possibly become into play. We didn't expect as quickly as they did, but and Jeff and his team have done every single thing correctly as well. It's it's just when they had called us and asked if we could do anything, I said that we could not, and it had to come before the board for any kind of rebates or deductions in the fees or whatever. It just, the new fee, the new regulations come with, the new fee and also the sewer capacity fee, where the Schimmel project is 100% different. And that still has the 500 for a few more months or about another year. And they're under the sewer privilege fee still until that gets sunsetted at the end of that project. We've worked with Jeff for so long, and it's just unfortunate at the times, but my hands were tied. That's why we had to bring it further. We would just need a guidance on, if we go forward with this, what timeline the board would be willing to set. When do we revert back to the old fee? What date would be the end drop dead date? And then going forward now, what's the end date of that? There would have to be some kind of an established time frame where we could go back to the old regulation fees or not.
David, your recommendation was for us not to grant this.
Correct. And
Do you have a middle ground that maybe you could propose?
It's just because of the complications of all the other fees that have already been paid and all the other applicants. I still feel that I was recommending against this being granted. That's why I had to come to you guys to see if I could get some more guidance from you or different options or ideas.
Madam Chair.
Melissa, Libby.
I just was going to comment. There's a very detailed bunch of information and timelines in the staff recommendation in your packet. The recommendation is not to grant this. That recommendation is supported by town administration. This is a very unfortunate situation that these people are finding themselves in. There was, however, in accordance with what's listed in the agenda information, a period of time during which this application could have been submitted prior to the regulation change. That's really why the recommendation is what it is.
Yeah, I understand.
If I may, Madam Chair.
Let me go.
Okay.
Sorry,
I'll wait.
Jeff, I just need to.
Yep, it's okay.
And then I'll go back to you.
Sorry.
Libby, could you repeat the last part of what you just said in terms of the recommendation? Because I just want to make sure I understood it correctly.
According to the information from the sewer department that's in your packet, there was a period of time prior to the regulation change that the application could have been submitted.
And was that period of time during COVID-19 and the shutdowns?
There were cumulatively 8 weeks total, 4 weeks before our office closure in March and 4 weeks after we reopened in May, during which time the application could have been submitted prior to the regulation change.
Jeff?
Yes, if I may. When the surveying and engineering offices were deemed an essential service, I think that everyone in my business would agree that we all went through a soft start. There were people that were employees that were not comfortable coming into work. If we absent COVID-19 from this whole equation, I wouldn't be sitting here before you because the application would definitely have been submitted prior to the June 1st adoption or implementation of the regulation. And I guess if I could, through the chair, ask a question to David.
Yes.
I think you mentioned 19 or so applications that have been, permits that have been issued. Are those permits all on lines that were installed within 5 years, or did you break down connections for properties that may have a failed septic system where the sewer line in the street has existed for many years? I do feel that the board should consider that this this to be a single application and not blow this up into a policy, I think people should come to you on a case-by-case basis because timing and circumstance are so unique, especially between long-established sewer line installations and newly installed sewer line installations. If David could, if he knows whether those 19 were for new or old sewer line installations.
Thank you, Jeff, for that. Now, top of my head, I do not know exactly. I know there was probably a mix in there. During the sewer regulation that we redid and rewrote, unfortunately, the 5-year or newer sewer line fees went away. The reduced fees went away to avoid confusion going forward from, was it 5 years? Was it 6 years? Or was it or 5.5 years? So that actually went away based on all our discussions with our consultants. Still to date, as just another piece, and I'm assuming it's because you may have been waiting for the hearing, that we still have not had an application yet submitted. And I'm assuming it was waiting for this hearing, but if we had at least had some kind of an application come forward, we could have at that time even issued a rebate or a refund if we had gotten to that. But the exact number I do not have, Jeff, as to how many were 5 years or older.
Well, I think that's an important distinction. And I guess I'm really having trouble understanding the distinction that was made for the Shimon Plus areas where the permit fees were frozen per the old set of regulations. I mean, if those permit fees had been increased and it was across the board, once again, there's no distinction between that new sewer and the new sewer in Field Avenue. So, I mean, once again, I think this is a single application. It is not precedent setting, and it is really fair for the commission to allow this permit to be issued under the old and current regulations. Old in the sense that this is not in the Shimon Plus area, but the Shimon Plus areas have the benefit of the old fee structure.
Yeah, again, just two totally different projects with two totally different timelines and time frames. Their sunset date is coming up within another year, and they will revert to all new regulations and fees. And actually, there's been numerous properties already in the Nantucket Harbor Shimo project that have had to pay all the new fees because they did not have a building permit before December of 2017. So just two different projects altogether.
Melissa?
I can't make that distinction. I'm sorry. I don't see it that way at all.
Thank you, Madam Chair. A question to David through you is when was this sewer installed and how long has this family had the opportunity to connect to it?
Well, let me just take and pull up that map. It was approved for construction in October of 2019, and the final inspection, I think I have on here. I don't have the final date, but it was within a year on that. However, it was privately installed by a property owner at Morgan Square. It was not a town project.
Jason?
So a couple questions. So what, David, what did your department do wrong? And if nothing else, that's my first question. And the second one is, I'm assuming this came to your department, David, and you said, no, we can't do this. And so now they're overriding you coming to us. And so we have to decide if we're going to back up the department head and what they've already decided. That's my two thoughts.
Well, hopefully nothing wrong. If I did, I'll be the first one to admit it. I mean, there was conversations with the property owner, with department staff here, and they had been informed that there was a regulation change coming and there was potential fee changes coming. And the second, I see your hand up again, just second part of that question.
Yeah, I didn't know if, like, was there a missing email and we forgot to get back to them? Like, was there anything that we just kind of missed or anything on our end from the town side?
Knowing my staff and the emails that come in and out, we hyper document everything. And if you look through the packets, 21 pages of submissions that I put in, we usually don't miss much. So every phone call, every communication between any of the parties were recorded pretty significantly. And again, they're all in that packet that I submitted.
Did our policy change in some way? I'll go to you, Libby, after this. Did we make any kind of a mistake in giving people too short of windows with our policy change, and particularly in the light of how upside down everybody's world got turned this past year?
I don't think so. We documented every one of the public hearings. We had 2 public hearings and 3 public hearings altogether in front of the board.
Yeah, I mean, more, not that we didn't get the word out necessarily, but did we just make the time frame too short for the, maybe Libby, I think, wanted to say something.
I was just going to point out that of all of the people who work for the town of Nantucket, Laura Kabati, who works at the sewer department, is one of the most meticulous employees we have. Her timeline is exactly, whatever she put in her timeline is exactly what happened. So I would say that the sewer department did not do anything wrong. The application was unfortunately not submitted in a timely manner before the regulations changed. And as far as did we give enough notice, that would potentially be an issue for the board to determine, but it was probably more notice than most fee and regulation changes get.
Okay. I don't think that the sewer department did anything wrong. I just want to make sure that we didn't give too tight of time frames across the board with our regulation changes and in light of COVID. Matt?
I would like to support that. The sewer department is run in a very efficient and you know, it's a very transparent and easy department to deal with. And I've always felt that David has been more than fair. I think that when the sewer regulation was the contemplation of its change, I think that this was simply a category of permit that slipped through the cracks. You know, we have these homeowners who are trying to do the right thing, and they're being, to a large degree, they're being forced to connect to newly installed sewers, even when their on-site septic systems have not failed. And that is why historically the sewer commission has, you know, reduced the pain of this, you know, mandatory connection process by reducing the fees for a short period of time, a 5-year period. So I want to speak in support of David's department, and David does a great job. So there's no thought that anything wrong has been done. You know, once again, absent the COVID pandemic and everyone's office is shutting down, we wouldn't be having this conversation. But that's what happened.
Matt? Then Jason.
Yeah, this is a private line, right? And this is, so someone has extended a line, some private individual has extended a line for their benefit, but it's going past a bunch of other homes that may or may not be in the financial situation that the person extending the line is. Is that, am I getting that correct in this situation? And the
Yes.
people all along there are now required to connect because there's a line available. Am I correct on that?
Yes.
Yes,
and what's-
you are.
Yes, you are. And what's required nowadays is anytime a private line is installed, we mandate that stubs be left at every lot so that the homeowner doesn't have to do any other reconnections. It's already on their property.
Right.
How much does it generally cost someone to do all of this, though? With like Jeff, your fee, the permit fee is for someone that this is being, somewhat sprung on. Excavation.
Between the pump, I'm sorry.
I'm just like, what is the all in for this homeowner?
Oh, it's easily $20,000, absent the permit fees.
Even with the stub?
Yeah, because you have to abandon the existing septic system, which costs money. You have to buy a pump. There's electrician involved, and an excavation contractor. So, easily above and beyond the permit fees, you're looking at a $20,000 or more effort.
This property is, just of note, that this property is within the My Comment needs area. So it is a nitrogen sensitive area. So it's, there was a benefit of a private developer putting a line down the road. And there's actually another one in the works as well on Folger Ave. But I got to thank Jeff for his kind words, and it's just an unfortunate timing issue, I think, still that I'm worried that we could end up in some dangerous territory with precedents.
Matt?
Yeah, and I think this is a minimum. Am I all right? Yeah, I think this minimum $25,000, give or take a little bit. People gain, they gain some ability. They can build slightly larger on their lot. They can put, sort of a couple more bedrooms in, et cetera. There's benefit there. But if you are someone who has sort of have scraped by and been struggled to even own a home, and then you're facing $25,000, it is substantial, and that you hadn't planned on, and that is all of a sudden required because of someone else's plans. And I've had people contact me sort of frustrated with, oh, I have to do this now. I just did my septic 5 years ago, or we don't have the money. I'm sending my kid to school. I've had all different phone calls about this. So I understand, some areas it's not a problem at all. It's but in other, like it's not a problem at all in some areas where it's, sort of trophy homes and homes are being flipped and other things are happening. It's a real problem when that line runs through, an Islander neighborhood with a lot of people who are making Islander wages and having a difficult time staying here to begin with. And so I think that's, I'm seeing that part of it in this, and I might be completely wrong, but I'm seeing that may be a more of an issue through that entire area if these pipes are run. And I'm not sure it changes my mind on tonight, but it does make me think maybe, like Don said, maybe there should be a little bit more time or something. I don't know what the answer is tonight, and I don't think I'd make a good decision on it if we closed it tonight. I was ready to support the recommendation, but I'm sort of wavering now, wondering if we should sleep on it.
Does the board, Christy, and I just want to pose the question, does the board want to take this under consideration to a next meeting? Christy?
Thank you. I've been listening to everybody and thinking about how to consider this as a one-off and not a policy. And I'm just having a really difficult time doing that. I think that we've had other people pay. I think we heard 19 people have already paid to install and have paid the increased fee. You know, if we could go back and change it, and maybe we should have had a little bit more time between raising the fee and the start date. I know that Jeff's office was probably backed up, and you know they had a small time window between COVID to get the application in. I think the only thing that I'd be comfortable with if we want to move forward tonight is if there's any sort of rebate, or you know, I'd say maybe $500 or $1,000. I don't want to set a precedent of waiving it all the way back to $500. And if people who already paid wanted to come before us and ask, but I wouldn't go forward and just kind of make it a policy that, you know, the fee is $500 reduced or whatever we would decide on. I think people would have to make the effort to ask for that support. So those are my thoughts.
I'm sorry, my internet froze for a second. Sorry, no, everything was frozen. I missed the end of what Christy said. But I just wanted to throw out there, I was considering whether we
She froze again.
Was I out again?
You just froze again.
I don't know if you heard what I said. I suggested maybe that the $2,000 fee might be a compromise. Jason?
Yeah, I just want to kind of clarify a little bit. I wasn't saying that sewer department did anything wrong. I just wanted to, you know, if we missed an email, we didn't get back to somebody, then I would say, let's own it. And we, you know, we made a mistake, but I don't see any evidence of that. And I think the department's already made their decision. I don't see anybody want to make a big policy change. And so we'll make a motion to go with the staff's recommendation.
Is there a second?
I'll second.
Is there further discussion? Okay, shall I go to a vote? Are you guys all ready to vote? Melissa Murphy? Oh, sorry, Matt.
Yeah, I'm not, because I'd like to sleep on it. I'm not sure. I'm not sure what to do in this, you know, what to do in this situation. And I'm having, you know, I'm having a hard time, you know, sort of, you know, I would like a little time to think, is there a, you know, could we have a, you know, I don't have the answer, but could it be a 3-month window, or, you know, or COVID window for 2 months? Is there something that I just haven't thought about it or looked at it enough? Is there something that is, you know, is fair? I kind of feel like something is telling me this isn't fair, and I can't figure out what. You know, maybe it's COVID and life right now, but something doesn't sit right. So I can't support it, but I don't want to not support it either, because, you know, so I'm really torn.
Madam Chair, I'd like a vote, and we can make, if it doesn't fail, then we could do something else.
Okay, Melissa, well, we're still on the motion.
No, I'm ready to go to a vote. That's fine.
Okay. Okay, Melissa Murphy?
No.
Matt Fee?
No.
Jason Bridges?
Yes.
Christy Ferrantella?
Aye.
I'm a no. I would like to take this under further consideration and try to come up with something. I do have a question for Jeff. Is how much time, and this, I mean, there were extensive emails, so this might already be documented, but like, how close were you to getting in at the window?
I'd have to go back and look at my, I can provide supplemental information if
you wouldn't mind. I think that I'd like to see a motion if somebody's willing to make this, to carry this over for 2 weeks.
Thank you.
Don, could I just give one more piece of information, just if possible?
Yes, please, David.
Just to just as a note, the cost of partial refunds for the 13 permits already issued is in excess of $25,000 in refunds we'll have to get. And the other 19 pending is around another 30,000 just for permit fees. So just, and there is a pretty extensive timeline on that same page that when Jeff was hired and everything, but I do appreciate everyone's effort tonight.
Thank you. Is there a motion? Matt?
I'll move to hold it over for 2 weeks.
Second.
Thank you, Melissa. Any discussion on the motion? All those in favor by roll call: Melissa Murphy,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Christy Ferrantino,
Aye.
Don Holgate, aye. Okay, the holdover carries unanimously. So everyone get what information you need.
Thank you very much.
Thanks, Jeff. Sorry, I've got to get back to the agenda on my screen. Next up, we have Amy Baxter from the licensing office to review liquor license fees for 2021.
Thank you. So in November, we are in renewal period for annual liquor licenses, and obviously other licenses in December. And I wanted to review again our policy on fees, and I will review kind of what we did in the springtime. If you remember in 2019, the end of 2019, you had approved an increase in liquor license fees across the board. Obviously, when the pandemic hit and a lot of restaurants were unable to open or closed due to lack of inspections, things of that sort, we decided to, in May, voted on to suspend that fee increase for liquor licenses that was approved in November of 2019. They're all invoiced for the previous amounts. Some annuals had paid the higher fee, which we will credit for future fees. In addition, you voted to waive the common vicular, which is the food service license for seated restaurants, for $50, and entertainment licenses of $100 were suspended for 2020. And again, those were not charged or will be credited for future licenses. And along with that, so I've given you, I think, a background as far as what that fee reduction came out in revenue. Waiving those fees for common viculars and entertainment is about probably $12,000 to $13,000 total. And again, we had not gone with the increase in liquor license fees. So the recommendation right now is to remain with that policy, to remain at that level. As far as what other towns are doing, I was just looking at Boston too as well. They have waived all entertainment license fees, any fees or licenses that are unable to be used as they currently were. They waived those, but liquor license fees were still being charged. What we also are recommending is what the state, kind of what they have done as well, the ABCC, is they're allowing renewal for licenses that are not currently operating due to COVID restrictions, and we have a lot of those. We are to renew those, and we have that discretion to renew them. And the state is not requiring insurance and workman's comp until such time those restaurants are able to open. So it's a similar type of policy that we're going through renewals, and that once a restaurant is able to open, or liquor license is able to open, then fees will be collected at that time. So the recommendation right now is to remain for that for 2021, because obviously we don't know kind of how that's going to be, but there will still be restrictions. And again, one other recommendation was that we come back in June to kind of see how things are, see who is able to open, if there's any sort of other waiving that needs to be done. But that currently is the recommendation. I'll take any questions on that proposal.
Questions? Comments? Jason?
Amy, did you say that, so if you're a seasonal restaurant, you don't actually, for cash flow purposes, you don't have to pay the fee until you open? Is that what you said?
Yeah, any restaurant, the seasonal, and I probably should have said this. Right now we're dealing with annual licenses, which we have 99 total. it's split almost in half. Maybe 48 are annual, and the over 50 are seasonal. Seasonals renew in March, so they're not up yet. So the annuals generally will pay their fees by December 31st. Also, common vicular and entertainment might affect a few others that do not have liquor as well. So those happen in December. So I wanted to touch base on that. But basically, and as the state is allowing two as well, understanding how everything is, the upheaval, is that not until they are open do they have to actually pay the fees. They don't have to pay by December 31st. If we're still in the situation in March, they pay. And we kind of do that sometimes with seasonals. Like if you're going to open in May, just make sure the fee is paid by the time that you do open. So we're following along those guidelines as well. And I got the approval from the state that that's acceptable practice right now.
Jason?
Amy, has there been any questions or for any year-round licenses asking to pay in April or May? Has anybody came to you for that? Just
yeah, and there's sorry, and before I even answer that, I'll say too, there were a few, maybe a handful, 5 that weren't able to use their license at all in 2020. The theaters, obviously, Whaling Museum, they weren't doing events. We did not charge them the liquor license fee, and will not do so, or we'll credit them for the next one as well. So if they weren't unable to open at all in those instances, we did not charge the fee. What did you just ask me? I think I just forgot what the question was.
I was just trying to see if there's a way for annual licenses to maybe, for cash flow purposes, maybe pay in April or May. Maybe we can't do that with ABCC or finance.
No, that's your choice to put that in there as well. We do have quite a few annual licenses that generally are open at this time of year that are closed until April at least. So we do have a great number of that, and those they will not be required. They just need to sign the renewal forms, which we've sent out so that we can process out with the state. And then as they are needed, we would be fine with that if that's something you voted through, that, if we need to work on that with them, can do so if they're able to open.
Christy?
Thank you. I'm in favor of the staff recommendation to keep the pricing the same as 2019 and not implement the new pricing we had agreed on for 2020. I think restaurants have, suffered through COVID. They're one of the hardest hit industries. So I think it makes sense to hold off on increasing those fees.
I agree. Does somebody want to make a motion?
I'll make that motion.
I'll second.
Second. Any further discussion?
Okay, just comment to make sure the places that can't open are not going to be charged again, correct? That's part of this. All right, good.
Correct.
Melissa Murphy? Matt Fee?
Aye.
Jason Bridges?
Aye.
Christy Ferrantella?
Aye.
Don Holgate, aye. That carries unanimously. Thank you for your work on that, Amy.
Thank you.
Okay, next up, we have the Town Government Study Committee, John Brescher.
Good evening. How are you?
We're great.
Great. So we are, for the record, John Brescher, Chair of the Town Government Study Committee. Our committee wanted to give the board an update on what we've been doing as of late. We submitted a memorandum with a handful of exhibits to sort of give you really just an update on what we've been doing, what we've been talking about, and what we're going to be trying to effectively gear up for town meeting in 2021, whatever that may look like. So I'm not sure if you have any questions, if you want to do that as a discussion, really. As I said, we took a bit of a hiatus, as I think most other boards did during COVID. And so we started ramping up again in June or July. and been trying to meet bi-weekly, monthly basis to get sort of this memorandum together and ultimately sort of continue to work on it to submit to town meeting for 2021. And I know Tucker Holland is on as well. Campbell Sutton may be on as well. But if you have any questions, please, happy to answer anything you may want to know about what we've been doing. No?
Campbell's on as a attendee if you want me to bring her in. Otherwise, I'll.
Should we just see if she wants to raise her hand? Oh, she's raising her hand. Campbell, come on in.
Good evening.
Go ahead. We can hear you.
Okay, I was just saying good evening, and I'm here to support John and our committee and the work we've been doing. So if there are, questions or anything like that.
Thank you. Melissa.
Thanks so much. Thank you, John, for coming on tonight, and Campbell, to you as well. I just think it's so important for this update that you provided in the packet. And is there any thought to further sort of publicizing that memorandum? And the reason why I asked that question, just a quick follow-up on it, is that I found that the questions at the polls this spring, although good, were not contextualized enough, I think, for the community. And I don't know that when people ask if they're happy with their form of government, that they really truly understand what the differences are between the ones that are available and to us. And I think there's going to be a lot of important community conversation when we get to a place where we're talking about maybe even hearing recommendations of changes. And my concern is that there's not strong enough communication with the community at large about what these options look like and what your research is finding. So thanks.
Madam Chair, do you mind if I chime in? Yep. Sure. Melissa, great point. It's something we grappled with too, frankly, because when we submitted the questions prior to COVID, and after COVID hit and the results came back, and part of our committee, some of us were saying, well, what do the answers actually reflect? I mean, when we say, are they satisfied with the form of government? Hey, that may be giving kudos to the select board for showing fantastic leadership during a truly unprecedented time. I mean, does that really mean that they're dissatisfied with the town meeting, or are they just happy and content with what the select board has done? Which, again, great on you for all the hard work you've done over the last 6 months. So we're sort of fully aware that the answers that were given may not be as precise or as focused or as direct as we may want or may need. And it's just one of those sort of imperfect scenarios that occurred. One of the things that I will add that sort of the theme of this memorandum, and that's something that we've been talking about too, is the need for education, civic education, call it that. And it's not your basic high school civics class. It is making sure that the populace at large, the general taxpayer, the general citizen, whether it be resident, non-resident, whatever, that they are aware of the mechanisms of government and that they don't have to be an expert or somebody who is living, breathing either town meeting or knowing the organizational chart within the town about, say, hey, I have a noise complaint. Who do I go talk to about that? The general idea is to make sure that there is education, and that's something that we're sort of cognizant of too, because if we're going to do another question for the 2021 poll or bring anything else to town meeting, you're absolutely right. There needs to be education. That people need to have a sort of an informed opinion of what they're voting on or what they're deciding. And that's something that we're absolutely cognizant of. And I will speak as sort of one committee member. I'm not sure we have a 100% great answer on how to educate everyone. That's one of the struggles that I think we're always going to have. But it's something we're aware of and something that we know is going to be underlying any decision that's made, or anything we do moving forward with any type of change, recommendation, whatever you want to call it. Part of it is making sure that when we get the results of whatever opinion we get, that it's an informed opinion. It's not a knee-jerk reaction. It's not something that somebody just thinks.
Tucker, and then Rick Atherton has his hand up.
Thank you, Madam Chair. I just thought I would add a little bit to what John was saying there. To Melissa's point, there were two non-binding questions that were included on the ballot last year. One sort of said, "Are you satisfied with the current form of government?" And I think that was roughly a 50-50 split in terms of the answer. And then there was a second question that said, do you feel that the Town Government Study Committee should continue to investigate the different forms of government that are out there? And so 2/3 of folks said, yes, we think that the Town Government Study Committee should invest time and so forth into looking at this further. So it was sort of interesting that folks who said they were satisfied also said, we think it's worth, understanding what the different options are that are out there. And I would say the group very much agrees with that education principle, which is why there is no recommendation. Certainly be very premature to have any sort of recommendation other than there clearly was an interest in trying to understand more about what options may be available to us. And so, as John just said, that's a critical part of, how do we educate people about the different forms that are out there, and certainly would be looking to work with you all on that aspect. Thank you.
Thanks, Tucker. I'll go to Rick Atherton. Oh, and then I think maybe Campbell wanted to talk again.
No.
Oh, Rick, go ahead.
All right, thanks, Dawn. Can you hear me now?
Yes, go ahead.
Well, thank you. I think there are a couple of things. One is the education effort, and often in these things, the devil is in the details, and it's hard sometimes to get the details out about the differences in the form of town meeting government. So we need to work harder on that. I also think there are a number of things, and I shared this once with the town manager in a conversation. In a time of COVID, it's hard for the town administration or members of the board or town council to spend some time with us reviewing more specific issues within the charter itself. And I think as we move forward, that time, to the extent we can corral town council, would be advantageous to the members of the select board and the Town Government Study Committee. So thank you for the chance to comment.
Thanks, Rick. Melissa?
Well, it may be really useful, and I think because we have this wonderful technology of Zoom, if we could do some kind of review of those options and maybe tempo things out a little bit, where maybe one session is just on what are the different forms of government available to us in Massachusetts, given the size of our community and so on and so forth. Just, so we have that somewhat, and I know people can go and pay attention to your meeting. So I'm just thinking of some communication strategies or some helpful things that may not make people have to dig quite so deep to get the top level version, so that when we do get to town meeting, it's not the first time they're hearing this bits of information, and they can be a little bit more informed in the debate. And that, I think that's been my biggest concern all along, is that, you know, sometimes when you have one-on-one conversations with people, if they start by saying, you know, this form of government is really outdated for our community, and you start to press the conversation a little bit, they may start to understand that, well, maybe we're limited in what some of the choices are, and how do those alternatives really look? And so that's the kind of, I think, broader conversation I'm hopeful we can have. So thank you again for coming tonight and bringing this forward. I really appreciate it. I think this is one of the more important conversations we will be having in the next year or two to come.
Absolutely. John?
Yeah, I agree, Melissa. And frankly, it's something that I don't think is going away. I just will share something that Rick was kind enough, Rick Atherton was kind enough to send me an article today about from Falmouth, that they had their representative town meeting and it failed for a quorum. So even the other types were still dealing with whatever COVID challenges there are, but it's as I said, it's an issue that's not going away, and something we need to at least start educating ourselves on.
Thanks, John. Matt?
Yeah, I love town meeting, and I can't imagine changing it, except when people come in and vote their pocketbook and then I'll walk out. And then I wonder, what are we doing? So that's when I start thinking, well, maybe a representative town meeting with representatives from the various neighborhoods would be a better way, you know, to do it. And so I know that that's what they're grappling with, are those issues most of the time, because I'd be one of those people who said, yeah, I'm pretty happy, but we should keep looking, because of incidences like that, where I just say, well, this isn't how it's supposed to be. You know, this is supposed to be us having town meeting, thinking about the greater good and thinking about everybody and each other, you know, not sort of lining our pocketbooks. And so I grapple with it as well. One of my recommendations, and I've sort of sent it to you guys a couple of years ago, is consider the select board being a 5-year term. I think 3 years is too short by the time, and I'm not asking because I want to stay here much longer, but I think by the time someone is on their second or third year, they're just getting their feet under them and then they're gone. And so I think, you know, if there were 5 years with one person up every year, you know, like the land bank and like the planning board and other regulatory boards, I think it might make the transitions and the, you know, management of the town a little bit easier.
I would agree that that's worth a look. I think that it's nice to not have the 2-person potential for changeover on the board. There's more consistency on the planning board with that. Of course, signing up for another 5 years.
We might all quit, but
Jason?
Yeah, I was going to agree with Matt and you as well on the 5-year. I think, you know, block voting and all that tricky ways when there's, you know, 8 people voting, you know, running for 2 spots. I just think, you know, 1 spot each time. I don't know how we do that and how we would set it up successfully, but I think we should go in that direction. I think I'm one of the lone voices that think our current form of government doesn't work. I thought this before COVID, and I really think it now. We couldn't move quick enough. We just couldn't do it with our town meeting form with COVID, and hopefully we'll never have to deal with it again, but it's just another crack in our system. But our system has the potential to be the best form of democracy, but it's not. We don't use it that way, not since I've been paying attention the last 15 years. And, you know, and you've heard me say this before, but our school system is 52% of color, and our town meetings are 0.1%. You know, it's not representative. And we should, you know, while we have this system, we should work to make it better. But I really want us to keep thinking about, you know, getting out of our town meeting form of government, not representative either. I mean, really moving to something different with some type of, maybe not a mayor, but something, there's got to be a go-between, right? Similar to what Cambridge does. I just think we'd be able to move faster. We're too complex. We have too many layers. We have big city problems, and we're doing it with a system that goes really slow, which is good sometimes, right? Because we don't make bad decisions too fast.
Thanks, Jason. Campbell Sutton.
Yeah, so thanks for that input, everyone. I would just like to sort of say that I think one of the issues, and it's a national issue, and that is participation. And I think that's at the crux of what we're really talking about, is how do we get more people of more diversity caring about the democracy under which they live or participate. And I think, a lot of people are maybe too busy, they have kids, or, as we all know, there's always another thing to do or another reason, but I'm reluctant to say that changing the form of government is going to give you a large difference in result. Even at the mayoral level, they have difficulty getting participation of the different cultures and different languages. And out here, I think we have a great opportunity to actually recognize some of the hurdles that folks from other cultures have had to get over to get here, but also have in terms of perceiving democracy and what that means for them. You're not going to get shot here for how you vote, but a lot of people come from places where that's a fact for them. So I think there's a lot of work at many levels, and I just wanted to say that I'm just not sure that with a big change of government, you get greater participation and inclusion. And I think that's what we're all really trying to get, is more people voting, more people listening to the issues, more people talking about them, not from oh, I heard this or I heard that or whatever, but from actually, when I speak with people, I can speak with people because I listen to the select board meeting, or I've gone to another meeting, or, so I have a reference point. And I still think that if we could get, the more people we can get involved, the better our government, no matter what form we choose, well, other than authoritarian or something like that. But that's just a personal plug. The better I think our democracy will be, our town will be, and our community would be. Thank you for your time.
Thanks, Campbell. One more comment from Rick, and then we're going to have to move on to the next item on the agenda. Rick Atherton.
Thanks. This reminds me of my email to John this morning about Falmouth, but in our meetings, Falmouth has often been brought up because it has one of the few representative town governments on the Cape and Islands. And I can't help but mention that Falmouth, with their representative town government, finds themselves in deep financial difficulty over decisions made by their representative town government in the wind turbine issue. Just, Google that for Falmouth and you'll find out that form of government doesn't always come out with decisions that really work well, as opposed to our form of government, which I think has stood us well over time. Thank you.
Christy, last comment.
Yeah, just to wrap it up, I just wanted to thank the Town Government Study Committee. I know that talking about the change of our form of government is kind of the hot topic, and we kind of put all of our focus on that. But I know that you guys have done a lot of great work in putting forward the airport capital funding to change. So that comes to select board to help that process this year. And I know you guys are also looking at a sewer and licensing board, things that would take some of that stress off of select board. So I just wanted to thank all of you, Tucker, and everybody else on the committee for putting in the time for this. Thank you.
Agreed. Thank you. Is
You're very
everyone?
welcome.
We'll see you soon. Matt, did you want to say
Real
something?
quick, Page 82, there's the dots on it are pretty interesting. The seasonal people, there's a split between seasonal and year round, which is interesting. In the, if people look at page 82 at, maybe that's because people have different experiences with other governments, or maybe it's because our seasonal have different expectations, but we also have a split there that we need to consider as we go forward.
Yeah. Thanks, Matt. I'm going to jump to the next item because we're getting close to 8 o'clock. Real estate items. Ken, this is the request for approval and execution of land exchange agreement with Peter and Thea Kaiser regarding 5 Weeder, 6 Nobodier, and 24 Surfside.
Thank you, Madam Chair. As I was preparing for tonight, I suddenly realized that my first meeting with the Kaiser family was almost a year ago, as we started to have the discussion. But as you will recall, at a town meeting in June of this year, we voted to approve the swap, the land exchange agreement, where the town will acquire the property at 24 Surfside Road that abuts the school property in exchange for 2 parcels in Surfside that were approved for disposition at the town meeting in 2009, as well as cash consideration of $370,000. What will happen is that the family will be able to rent the property for up to 3 years, pay fair market rent, and at the same time, the school will be able to access the property in terms of doing their planning for the expansion of the school property, which is one of the principal reasons for acquiring this property. The agreement has been drafted by town council. We've gone through a number of iterations with respect to it. And I recommend and town council approves the execution of the land exchange agreement. I will be back in front of you in 2 weeks with the formal language for the actual closing of the transaction that would be closed on December 4th. So I would ask I would be happy to answer any questions, but for tonight, the request is to approve the execution of the land exchange agreement with the Kaiser family.
Matt?
I'll make that motion to approve it.
Second.
All those in favor by roll call. Melissa Murphy?
Aye.
Matt Fee?
Aye.
Jason Bridges?
Aye.
Christy Ferrantella?
Aye.
Don Holgate, aye. And it's so great that we were able to put this together to acquire parcels adjacent to the school for the ongoing campus needs is really important. And I really appreciate the Kaiser family being willing to negotiate and work with us on a way to do that. Next up, request for approval of consent to land court petition for approval of a plan for covenant lot parcel F on land court plan 5004-113 to be created at 28 Norwood Street, and to authorize town council to execute consent on behalf of the board.
Yes, the property owners on Norwood Street have applied to the land court in order to be able to subdivide the parcel. The town has acquired the street next to the property by taking by eminent domain. And as a result, because we're in a butter, the land court requests that we consent to the application for the subdivision. Town council has reviewed the documentation and indicates that there's no problems with it, and suggests that she said it is satisfactory for execution. And so my recommendation is that we go forward to authorize town council to execute the consent in order to allow the property to be subdivided by the owner.
Any questions, comments, motions? Matt?
Move to approve the execution.
Second.
All those in favor by roll call, Melissa Murphy,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Christy Parentella,
Aye.
John Holgate, aye, carries unanimously. Thank you. Next, we're on to public hearings. I'm going to turn this one over to Jason as I have a conflict.
Thank you, Madam Chair. So Erica, just to be clear, we'll open the public hearing and somebody will make a motion to continue it. Is that
You're going to reopen the public hearing and yes, make a motion to continue to December 16th.
okay? We're going to reopen the public hearing to consider the taking all portions of paper streets. This is for portions of School Street, Laurel Street, and I'm not even going to try to say that.
Shawakama?
Avenue. Thank you. Is there a motion to continue?
So moved.
Yeah, second.
And that would be continuing till December 16th.
Yes.
Is that your motion, Matt? Okay. All those in favor by roll call. Melissa Murphy,
Aye.
Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges, aye. That's 4-0. Don, can you come back for the second one?
Yeah, I'm back.
Thanks.
Next up, we have a public hearing to consider a utility petition from National Grid. This is for 52 Surfside Road. Fabio, are you still with us? Sorry for the long meeting.
I'm still here. Yeah, so we have a customer that has a garage that's being fed from a different property, house number 50 on Surfside, and he wants to have his own dedicated service. So the feed is on the opposite side of the street, so we need to put a handhole and 2 3-inch conduit to go underneath Surfside Road to feed the property. I don't know if you have the sketch in front of you.
I don't have it in front of me right now because I've got the agenda, but are you going underneath or do you have to cut the road?
So from talking to David Gray, it seems like he has a sewer project to resurface. I mean, to going on a Surf Road, and they're going to resurface Surfside Road. So most likely would just be a cut instead of a directional drill. Yeah.
Okay, because of the expansion of the sewer line, right?
Correct. Yeah. Oh, there it is.
Does anybody have any questions or thoughts on this? This is a public hearing. Is there anyone from the public who wishes to speak on this? I'm not seeing any hands. Can I close the public hearing? Does somebody want to make a motion?
I'll make a comment first. I didn't see this. Usually we have this in our, maybe I just missed it in my packet, but I didn't see this till now. And we usually have a recommendation from staff, you know, regarding what the concerns are, if there are any. Did I just miss something? Did it come late today? Or?
You know what? I am so sorry. I was just looking through the packet for it and I realized it wasn't in there. And no one pointed it out. So I'm going to pull up the departmental comments right now.
Yeah, is there anything we need to add to a motion?
Most of it was no issues. David Gray noted the sewer issue, which it sounds like Fabio's already aware of. And Wanacomment Water will mark out any lines prior to.
They just need to be contacted.
Yep. Does someone want to make a motion to for them to move forward in accordance with the staff recommendations?
So moved. Now that I've seen it, I can vote on it.
I'm so sorry. I can't believe it wasn't in there.
Thanks, Eric.
Second.
All those in favor by roll call. Melissa Murphy.
Aye.
Matt Fee.
Aye.
Jason Bridges.
Aye.
Christy Parentella.
Aye.
Don Holgate, aye. Appreciate it. Thank you.
Take
Fabio,
care.
have a good night. Last, we are on town manager's report.
Okay, so first off, we've got the fiscal 2021, our current fiscal year, first quarter budget reports. You've already had some of these a couple weeks ago, and these are the remainders: general fund, island home, and airport. So I we just go in the order that there are on the agenda. The general fund, Brian is going to, finance director will take us through this.
Thank you, Libby. Good evening, everyone. So the first quarter, as I always start off with a word of caution. Every year when we've presented that the first quarter is 3 months of the 12-month period, and there's a lot of things that can happen or change in the next 9 months. So I know that some of the revenue certainly looks good. We collected $22 million in real estate taxes. I will tell you that about $1 million of that was prepayments that were received prior to June 30th. So that's one of the reasons, which is substantially higher than we've ever had in recent years in prepayments before the end of the prior fiscal year. Building permits, license, electrical and wiring permits are they're down. They are trending on where we have forecast the budgets to be, and we're watching them very closely. We have noticed that filing fees for building permits and such are trending upwards, but right now it's not necessarily translating into completion or acquisition of building permits and the fees associated with that. So it's something that we're paying close attention to. Meals tax was down 44% over the prior year. We received just under 280,000. Prior year, we received just under 500,000. So certainly, even with the outdoor seating, we certainly did experience a decrease. As everybody remembers, we did actually plan for no meals tax in the budget that we presented. So while we did receive some, it's certainly less than in prior years. On the revenue side, on the expenditure side, we are tracking very, very closely to the budget. The one part that I would note certainly was the fact that we in the Marine Department did have some additional seasonal staffing, which increased the cost in the first quarter, and in the Marine Department, which was due to the demands of on the lifeguards and beach surveillance during the summer season. We certainly noticed an increase in people utilizing the wonderful beaches that Nantucket is known for. So it certainly was a contributing factor to some increased costs there. We are reviewing and looking to see if there is any CARES Act or FEMA eligible reimbursement, which would help offset some of that. We're also looking to see exactly where we are with the beach revolver, and we may be able to make a transfer for some of these costs into that. But it's certainly something that we are cognizant of and watching as we move forward. Other than that, I do want to again caution everybody that there is a very long way to go for the general fund in with the remaining 9 months, and with so much uncertainty. Even though things certainly appear to be heading in the right direction, it's still we're proceeding very cautiously in the finance department as we review this and we look at the revenue numbers to try to extrapolate what we can do with fiscal 22, taking a very cautious approach in how this is what's happening in this year, just because of so much uncertainty. Overall, capital investments, with the exception of the county assessment, which I missed when I was reviewing this, we had about $1.6 million worth of capital expenditures that we completed or have paid for during the first quarter of fiscal 20. That's on a couple slides down, Erica. And then I'm going right to that one, so that's perfect. We did not have any financing activity in the first quarter. All of the financing activity that we completed was in the second quarter, which will be reflected in the next report. And we did have a ratings call with Moody's in September, and they did reaffirm our AAA rating, and we've had no further activity with Standard & Poor's, so we still maintain the same rating with them. We've provided the investment report from our investment advisors on their outlook on the markets and how our investments were performing, and we do speak to them on a regular basis and have monthly reviews with them on how we're doing. So overall, again, cautiously optimistic that the remaining 9 months will continue to progress in the same manner, but certainly keeping a very close and watchful eye on both revenue and expenses. So does anyone have any questions?
Anybody? Okay. Thanks, Brian.
Thank you.
Good job.
Oh,
Libby, you want to introduce?
Sorry, multitasking. Next is our island home, and I would like to introduce our interim island home administrator, Bob Eisenstein. And Bob and I actually have not met face to face until right now, although we have talked on the phone a number of times. So Bob, very nice to meet you.
Nice to meet you.
Thank you for coming on and sitting through. So Bob's going to take us through the island home agenda with support as needed from Rachel.
Sure. So in the interest of time, what I'd like to do is just kind of give you the high level review. First quarter this year, July, August, September 2020 compared to last year in a fiscal year. So it's an interesting story. What you'll see here is from a financial performance is actually a good story. We're up on revenue and down on expenses compared to last summer, which is very interesting. We've had a lower patient days in occupancy. This summer, on the first quarter, we averaged about 76% occupancy, 3130 patient days compared to last summer, which was about 88% occupancy. Now, the reason for the increase, I have to give a shout out to Cassie Butler, our business office manager. One of the primary reasons for the increase in revenue, 29% increase over last summer, is we were able to collect a $100,000 old private pay account that became paid in this quarter. And Cassie's done a great job on collections. The other two reasons are we've really done a better job on converting mass health pendings to active Medicaid payments. So we're getting paid in a more timely fashion from Medicaid. And then the third reason is we've actually had an increase overall in private pay census this summer compared to last. And the rates went up from 500 to 560 per day. So those three reasons combined allowed for a $242,000 increase in revenue compared to last summer, last quarter. On the expense side, just going into the summary again, you'll see also our expenses were down 13% compared to last summer. The primary reason for that is that we had travel nurses, and travel nurses, as you know, are very expensive between the housing and the wages. We were able to actually get rid of one entire full-time travel nurse this year. We're down to just one nurse right now. So the expenses for that person over a quarter is pretty extensive. And in addition to that, we've actually, we've held some of the positions because of the decrease in census. So those things combined, we're able to hold expenses down. So again, like what Brian pointed out, this is just one quarter. For the rest of the year, I'd love to say we're going to get a $100,000 outstanding account paid every quarter, but I don't think that's going to happen. But for the quarter so far, it's actually a good news story. And just to give some relevance to what's going on in the rest of the state, even though we're at 76% occupancy, what's happened in the rest of the state due to COVID, that's actually on average probably higher than most other nursing homes in the state due to the fact that we've been very lucky at OIH with no COVID. We've been able to remain fairly full. We have not had to have a lot of patients on precaution. And in the rest of the state, unfortunately, they've had to use precaution rooms, downsizing their bed size, and most of the average census can be anywhere from 50 to 60%, actually much lower than we're doing. So even though it's a small facility, we've held constant. We're actually going up a little bit. We're at 35 today, and we've got a couple of admissions pending. So I don't know if you have the next slide on the census data. Do you have other slides there? Yeah, so just moving along to this. By all means, if there's questions on the specific line items, I'm open to questions, but due to the time frame, I'm trying to be cognizant of that. This graph here points out when you see the graph on Medicaid pending, the smaller number is actually a good number. That means we've been able to convert Medicaid pendings much quicker. And so you can see the difference between this summer and last. So we've been able to get paid more timely on Medicaid. The Medicare is significantly lower than last summer because of the census is lower. And the private pay census is going up a little bit. So, and you can tell over time, the Medicaid is about equal to last year. So again, the difference on the revenue side was really due to a very good collections effort this summer. The revenue breakdown is below. It's really pretty much says the same thing. And then the next slide, you have it. Again, if there's any questions here, you can see again on the revenue is just giving you the line items, the exact same number, 29% increase over last summer. And you can move along to expenses unless there's any questions. Just another way to look at it. On the expense side, there were some minor differences within some of the line items, but again, the overall expense is 13% better this summer. Less expense. We've had some internal increases on repairs and maintenance, for example. We had to put in some new doors, some new exit doors, and some other inside maintenance projects. But overall, the expenses are down compared to last year. The only other thing I wanted to add real quickly is that there are a couple of changes to the state regulations related to COVID that might impact future projections, both operations and financial. One of those is they have mandated an increase in staffing ratios for nursing homes. The numbers won't mean anything to you, but it's a 3.58 per patient day ratio that we have to get to. And that's just an overall increase in CNAs and nursing. And for our island home, we're right on target. It's not going to make a big change for us, but throughout the industry, that's going to be a big lift for some of the nursing homes. The other thing that's changed more significantly is the square footage requirement. And it hasn't been put into law yet because there's been a lot of outcry from the industry. But that's something, if it's passed, just to give you an example, right now, square footage in bedrooms is 80 square feet per bed. And we're at 84 square feet per bed, so 164 per bedroom. It's going to be going up to 108 square feet per bed. That's a significant increase. The reasoning for it is to try to, allow for more social distancing and try to deal with the COVID outbreak. But just to put that out there so that you guys are aware that we're hopeful that will not pass. That's not going to come through till 2022. But those are just two quick items I wanted to pass along. And I know that it's getting late, so I did this very quick overview. If there's any questions, I'd be very happy to answer them.
I can't see everybody. Did anybody have any questions? Oh, I see Christy.
No questions.
Hi,
I just wanted to welcome you and say thank you. And
thank you.
Glad you've been brought up to speed.
Thank you very much. Appreciate it. Just one other quick thing. I know it's late, but they did come out. We're on a call every Wednesday with the Department of Public Health, and the state is worried about the spike in COVID in nursing homes as well. Getting back to what you guys were talking about earlier, they're putting out a new measurement called a cluster, and that's 2 COVID cases or more per nursing home. And just for information purposes, the clusters that they're measuring doubled from last week in the 30s to over 70 nursing homes with more than 2 or more cases in nursing homes. Again, we're very fortunate here at OIH. We've never had a case, so I don't want to jinx it, knocking on wood. But just to give you the perspective, you guys, the island's been doing fantastic as far as my perspective compared to nursing homes, outside of the island. So I'm very pleased to be here and glad to meet you all. Glad to meet you, Libby.
Bob, thank you so much. Great to finally see you. And that was an excellent overview of Island Home. So
thank you very much.
We'll be talking soon, I'm sure. The next report is for the airport, and the airport manager is on.
Thank you. Good evening. Erica, if you could just bring up the summary page. The revenue for the first quarter at the airport was down $2.3 million or 24% from 9.7 million to 7.4, again, associated with the pandemic. The expenses, excluding debt service, were also down. They're down about $2 million from 5.5 to 3.5 over last year, but 1.1 million of that is attributed to a decrease in fuel expenses. So we saw a significant decrease in fuel sales. We saw about a 63% decrease in our commercial passenger traffic. So, but the good news is the October fuel gallons sold were up 76% over last October. So we're starting to see a little bit of a recovery. Basically, though, this resulted in net earnings of 3.8 million compared to 4.1 last year. And after applying all the encumbrances, carry forwards, all the other things, the net surplus was actually just a little bit higher than last year at 2.4 million versus 2.3 million from fiscal year 2020. I do want everybody to be aware of something though. When I say the transfers, we typically do a $400,000 transfer from the PFC or passenger facility charge account. And we're able to do that, but we're looking forward in the planning aspect because the reduction in employments is directly related, but it's a lag time to our passenger facility charges. So we're keeping that in mind as we go forward. So previously with the certified retained earnings of 3.5 million, the current surplus of 2.4, and then taking out the transfers and such for capital, it's projected that the fund balance at September 30th was just over $3 million. It's also important to note that we were very fortunate to receive $6.2 million in CARES Act funding, and it's been used to offset our salaries, and it's also going to be used in FY22 to offset a number of our salaries, but then it'll be depleted. So we're very fortunate that we've received that money, and that's worked very well for us. So with that, if anybody has any questions, I'll be glad to answer them.
Jason?
I just want to say that nice work, Tom, and it's great that we got that CARES Act. That's really, really fortunate. I didn't know it was to that level. So thanks for letting us know.
I do want to, if I may, Madam Chair, just to get on your radar too, though, we do have a couple of big ticket items coming up at the airport over the next year or so that are not eligible for funding. So it's going to be 100% airport money. And we're working very closely with Brian on that to make sure we can manage it as appropriate.
Thank you.
Thank you.
All right, next, thank you, Tom, is the monthly town management activity report, and it's in your packet. I tried to put in bold text the items that have changed since the last report or been added or have occurred. So I'll just quickly go through those things. The Coastal Resiliency Plan, there was a kickoff meeting with staff and consultants a week or two ago. And there's an upcoming meeting with the Coastal Resilience Advisory Committee with the consultants. The strategic plan, we are doing follow-up right now from the board's October retreat. I sent you all a report about it the other day, and I meant to follow up with the chair and vice chair about that today at the agenda meeting, but now I'm realizing I completely forgot about that. So I'll get with you guys next week about it. Meetings, as you can see, there's lots of meetings going on. We've started to review the status of the fiscal 22 budget development with the cabinet earlier this week. The Board of Health met last week to address the fall surge, and there's a Board of Health meeting again tomorrow. We are got some staff attending capital project committee, capital project meetings with Capcom, and we had the joint select board finance committee and capital program committee this yesterday. I guess that was pond management. You had a report in October from the chair of the the Nantucket Pond Coalition, and as a result, we've added Maya Comet Pond dredging as a capital item into the capital improvement plan for fiscal 23. Fall surge, of course, with COVID, lots of messaging, meetings, et cetera, all those things I mentioned earlier. There was a coastal resilience workshop with an MVP grant that we had this past Saturday. I was not able to attend it, and I'm not quite sure how it went, but hopefully it went very successfully. And then some COVID items, the weekly conference calls with the Department of Public Health, which is actually twice a week, the sub-EOC meeting once a week. There was a FEMA meeting, an informational session with FEMA officials held on November 5th about newly issued coastal erosion projection maps. That was very interesting. And I don't know if other people attended, but there was a Community Foundation of Nantucket annual advisory meeting earlier in October. A lot of projects going on, Island Home. So at the board's meeting of October 14th, we had discussed some stakeholder forums that had been underway in September, and we are planning additional stakeholder and community forums for January. We've been working on a strategy for public beach access, pursuant to a board vote in October of 2019. We've had an executive session on that, and then it's been continued a couple of times, and now it's hopefully going to be scheduled for early December. PFAS response development and island-wide risk assessment, that is well underway, and we are currently in the process of planning hopefully a joint meeting with the Board of Health and the Select Board in early December to review where we are with that. SBPF, I think you all know there was a Conservation Commission meeting with them on November 5th, and there's a little bit of follow-up from that going on internally. We had a meeting with the owners group of Harbor Place this week, last week, and right after Thanksgiving, there's another one, and we're working together internally with our consultant on concepts for transportation improvements in that area. The Washington Street, Francis Street intersection, we've got design and the project scope under review. There also, we had a complaint about Zoom meeting security as well as an issue with Zoom meeting security that I think you all are aware of a few weeks ago. So we're working on that. And I think I had some email today from our IT director about newly issued Zoom security issues. Erica, you probably saw that. I've been trying to keep track of items that we had to put on hold due to COVID, so they're listed here. And some of the ones in bold, we're working hard to get back on track. And so that includes revisions to the yard sale program, Nantucket Water Quality Improvement Options Report, pool discharge regulations, the strategic plan, you know what's going on with that, and paid parking. And at some point, we're going to need board direction about that. Personnel, we've got a few things highlighted there. As I think you all know, our DEI director, Diversity, Equity, and Inclusion director, had to very unfortunately decline the position. We met with her today with other members of the internal interview group, and she was helping us plan out some next steps. So more will be coming to the board on that shortly. Human Services Director is a position that we are working to fill with the departure of our beloved Taylor Hilst. And recently we've established an assistant Our Island Home Administrator position that was filled with Michelle Monroe from Human Resources. And so now we have that to deal with, but that's going to be a big help, I think, hopefully at Our Island Home. Pending is 2021 annual town meeting logistics. Got a work group going on that. And there were some questions. What I'm trying to put in this sort of new pending category is some items that may have come up from a board meeting and where those items stand. So there were some questions about Chapter 91 licenses at your meeting on November 4th. And I am still working to track that down. COVID has interfered with everything every day. That's about it.
Thanks, Libby. Does anybody have any questions?
Just a quick comment. One thing that was interesting, I don't know if it was our meeting or when, but somebody said that some communities have a Chapter 91 committee that works on that. And I thought that was interesting because it's one of those things that we talk about and we see we've got sort of, it's hard. You have to go to Boston to get it. And Jeff is too busy at Concom, et cetera. But it's, if we, at some point, it's something we won't want to think about.
Matt, good point. I have actually talked with members of the Roads and Right-of-Way Committee about that, and they have bird dogged a few things here and there on Chapter 91. So if we get every now and then we get a request for a modification to a Chapter 91 license, and I usually have Jeff and them take a look. So they are somewhat involved. It's not their main focus, but it's something.
But we could change it and we could change their charge perhaps and make it a bit more of a focus and define it, because some of the things we run up against are, sort of historical and no one has all the historical information and it's a limited number of properties. It could be able to be done if people took it on and really did it. And so I just think if they're willing, it might be a good idea to change their charge or consider changing it.
Oh, Rick has a comment on that. Rick Atherton.
Yeah, just to follow up on the Chapter 91, we've had sort of speaking, I guess as an individual, but also as a member of the Roads and Right-of-Way. And Chapter 91 is very closely tied to public access. which I think is one of the primary charges to the Roads and Right-of-Way Committee. And we would like very much to help the town review Chapter 91 new licenses and modifications and the impact of people going to the Conservation Commission on their Chapter 91, if it already exists. And it might just be as simple as making sure that when those items occur, they're simply referred to the Roads and Right-of-Way Committee. And that would give us a chance to review them in a public context. And it shouldn't result in any more workload for the town. Thank you very much.
Thanks, Rick. Jason?
Yeah, Libby, could you just refresh my memory on the Harbor Place and what was passed at the town meeting and the study and kind of where, I don't know how much you can remind me.
Sure. A couple weeks ago, the board approved a contract with Weston and Sampson. The town meeting approved $150,000 to engage consulting services to help develop concepts for transportation improvements, just in a nutshell. There's a little more detail than that, but that's overall in that area. And so they have started meeting with us to work that out as to what those things are. And we may actually need to come to the board at some point to get board input on some of those ideas. I don't know if Don or Matt want to add to that. They've been involved too.
Not tonight.
It is ongoing though.
Yes. Committee reports. Jason?
Just a comment that I want the board to think about. You know, once we get to 8 o'clock, I get it, like not tonight. I mean, we're already in our normal time, we're getting close to 10 o'clock, right? Which is always like in between 9 and 10. I remember over the years, that was always the hardest time to stay focused. We may need, especially if COVID is continuing to be more complicated, to have a second meeting. And this is, I'll give Christy credit. We were talking about this. I know nobody wants another meeting, but COVID really needs 90 minutes at least to talk about, you know, with having Gary Shaw and other people coming in. And, you know, so we're really starting our meeting about everything else that's on our plate 2 hours into it. So just a thought, we may not be able to schedule it, but maybe it's every other week, once a month when needed. Just want to throw that out there and keep that in front of our minds. Hi, Erica.
Okay, Erica.
Hi. I just wanted to say that if you really want a second meeting, the chances of it being Monday through Thursday are between slim and none. So you'd have to have either a daytime meeting or like a Friday meeting.
Yeah, well, I'm sure we could find a way if it's needed. It's important.
Christy?
Thank you. Just a couple updates from the Affordable Housing Trust Fund. We received a couple of proposals. We put out an RFP for the Neighborhood First funding. So we have a small review committee that's meeting and looking at those proposals. We have another meeting again this Friday. And we also put together, I'd say kind of an easier version RFP. I don't know if you really want to call it an RFP, but something that will go on the website for if properties come up or people need to apply for funding like Habitat for Humanity or Housing Nantucket. There's another application to apply for trust funds, not the Neighborhood First funds. We also have a new logo. So we're kind of rebranding the Affordable Housing Trust Fund, trying to make it a little bit more relevant and get out there on social media and on the website. And then I just have to, of course, keep pushing for affordable housing as I do every meeting. A lot of our current clusters are due to crowded housing. So I know that we have a lot of proposals, coming from Tucker and things coming before the board. And I just really hope that we take a strong position in supporting affordable housing over the next couple of months and years ahead. So thank you.
Thanks, Christy. Melissa?
Thank you. I just wanted to let everyone know that in collaboration with Remain and the Chamber of Commerce, there's grants of up to $5,000 available for small businesses. They have to have already been established businesses and have some positive cash flow, but this is a really unique opportunity for a group of businesses to get some support, maybe launch some new ideas this year, participate in e-commerce. And so I highly encourage everyone to contact the Chamber of Commerce or Karen McCumber if you have any questions or want more information. This is a great new initiative. It's not often that for-profit businesses are given grant opportunities like this.
That's great. Anybody else tonight? Or we're meeting again tomorrow, 9 a.m. So I want to make a motion to adjourn.
Motion to adjourn.
So moved. Second.
Thank you. All those in favor by roll call. Melissa Murphy.
Aye.
Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Nat Fee.
Aye.
Don Holgate, aye. Thanks, everyone. See you soon.